Okay. Good afternoon, everybody. I hope everybody's here. The county board is in session. We have a work session today. We continue in our budget work sessions for the fiscal year 26. Today we have two very important departments. The first is the Department of Human Services, and then we will be talking about housing and CPHD, the community, urban and planning, housing, and development. So we are starting with DHS. Mr. Manager.
Yes,
Thank you, everybody, for being here.
Yes, I'm going to turn it over to Anita and her team, and we have lots of people in the audience who are here to see you. So over to you, Anita.
Okay, thank you, everyone. We're very excited to be here to do our annual presentation of the DHS budget for FY26. And before I get started, I just want to recognize some of the folks in our department, if you don't mind, because they are critical to the operations and leadership in our department, and I just want to say thank you to them. We have Deborah Warren, Glenda Pittman, Corey Travis, Brooke Hammond-Perez, Caitlin Hutchinson, Kurt Larrick, Tabitha Kelly, Michael Dharma Irwin, and Regina Chambers. And back there I see Jim Baker, Yan Ben, Ian Moser, Natasha Minocha, and Linda Erskine. All right, so thank you all for coming.
Welcome.
So let's, I guess, get started with the first slide. Deborah and I will be tag teaming, and we'll just go through and see, if you have questions, let us know. So DHS, is the largest department in the county government. We provide human services to Arlingtonians from prenatal to end of life. We serve about 50,000 residents yearly through 100 programs. We operate through 5 customer service-facing divisions and 2 administrative divisions. And for the projected FY26, we have 820 staff and a proposed budget of $204 million. We've had significant growth in many of the programs over the past few years, but to highlight some of the largest ones that we serve, our call center is really the hub for inquiries from people in need in the county. And at the main central customer service center, we have almost 90,000 calls per year, plus another 20,000 going to emergency services. Medicaid is the single largest program. It has almost 30,000 participants, and SNAP has almost 10,000. We have close to 7,000 behavioral health clients, and you will hear more about housing statistics and data in the following presentation. So, just to mention, our staff is not just in Sequoia Plaza, for anybody who thinks we sit in Sequoia Plaza. We are in the jail, we are in the schools, we are in the hospital, we are in the community centers, we go to people's homes, so it's really a very mobile team. Next slide. This highlights the growth of the department over the last few years. It's pretty precipitous, as you can see. The blue line is the growth in expenses, the orange is the net tax support, and the gray is the revenue. And from 2021 to 2026, you'll see that our budget has increased 39.5%. Revenue has grown by 32.3%. We obtain a lot of federal and state grants. And the growth in FTEs, which has been about 105, is largely in direct services. And this year we will be taking on some tasks to analyze the administrative and financial tasks that are faced by our department and trying to reallocate those resources based on where there is most significant growth. Next slide. We are very committed to our DHS vision, mission, and values, which we changed in 2022 to center race. We are not just providing healthy, safe, and economically secure services. We are committed to trying to have a just and equitable community that is free of systemic racism. The reason we center race is because we basically intercede with many different systems like health, education, housing, employment, criminal, legal, and we recognize that there are systemic barriers for people who are Black, Indigenous, or of color, and we believe that we need to look at those and peel them back and do something about it so that our own organizational policies and practices will be equitable for those who receive services. I wanted to also highlight that in 2023, the department completed a SWOT analysis, strengths, weaknesses, opportunities, and tasks, along 4 domains: community outreach, service delivery, employment, and finance, and we have identified specific action items internally to our process and practices so that we can advance racial equity throughout our department. We now have a racial equity implementation plan, which is unfolding, and we're already delivering some of those items. Next slide. We would not be able to do this work without REAP, Racial Equity Advancement Partners, who were honored this year with a Community Manager Excellence Award. It was created in 2019 and now is about 50 staff organized in these 4 committees: community engagement, vision, mission, values, capacity building, and culturally and racially responsive practice. We have regular meetings and discussions throughout the department. In 2024, the REAP capacity building team worked together with Challenging Racism, and we developed a 3-part, 9-hour mandatory training for all 800 staff, delivered in 58 sessions. So that was accompanied with lunch and learn discussion sessions. So we have some foundation, and we know we have a long way to go, so we're working. Next slide. Simultaneously, we have been working on the development of a strategic plan. What, you may say, another plan? Well, we have a lot of plans. We have the age-friendly plan, we have the Project Peace plan, we have the plan to end homelessness. We have a lot of program-specific plans. We do not have any DHS all-encompassing plan. So we went and analyzed all of these different plans, and we found the common threads, and we identified 4 strategic areas that we will be focusing on the next 5 years: optimal health, housing stability, well-being and prevention, and economic security. And all of our performance measurement plans actually feed into these areas. We're trying to just establish sort of a roadmap so that in the future, those who come to lead the department will know where we're going. And we hope to finalize this plan by the summer or fall of this year. And we will be showing that to you separately. Next slide. So we talked about racial equity, we talked about strategic plan. You know about some of our operations with these. William Way wants to be admitted. DHS has a lot of initiatives and accomplishments. This is the handful that we wanted to mention because there are some changes and new things that you may want to know about. So Project Peace, for example, and I'm thankful to the board for taking such a close interest in that. We've had excellent liaisons through Matt and now Maureen. We had a series of stakeholder sessions, and we decided to restructure the governance so that the leadership roundtable is now an executive team, and we've streamlined some of the committees so the meetings are not redundant. Also, we've had our partner shift program, which I think you may know about, is Arlington's only domestic violence intervention program, and it's gone from serving 50 clients in 2021 to 150 in 2023. And that seems to be, there's increasing demand because these are court-ordered clients who've been arrested for domestic violence in Arlington. And we have programs for men, for women, English, Spanish, and we are able to really try and reorient people as to how they should be in a relationship and with their significant other. In public health, I just want to mention, you know, Dr. Varghese retired in November. Since then, we've had an acting division director, Robert Sharp, and an acting health director who is from Fairfax, Gloria Adoa Yensu. She meets with us weekly. And the county manager for this coming budget year has agreed that we will divide that leadership position of public health into 2 positions. We're going to have a public health director and a division director. We had that before Ruben. It was separate, but I think it was for budget savings purposes, we combined them. And what we found is that it's hard to find the same kinds of qualities to serve in both functions in one person. So, because the public health director really is, you know, analyzing the epidemiology of the community by population, they are developing and managing public health policy, they are preparing for emergencies, they are enforcing the Virginia Code, they are the spokesperson for the public health on all matters, and especially in emergencies, reporting to Mark. The division chief, what we call division director, really is a manager of operations, administrative operations, personnel, clinics, school health, and so we have decided that it's better served by 2 different folks. Now, we have done some efficiencies. We outsourced the neighborhood health, the dental clinic to neighborhood health last year, if you remember. We have also transferred maternity clients to Virginia Hospital Center because there they can get all the services in one place. And we've moved the newcomer clinic with TB to others. We have freed up over this past 6 months 3 vacant FTEs, which we have now repurposed for school health. Because our aim is to try and fulfill the demand of the community to have a school health nurse in every school. And so now, in addition to all of the high schools, we have a school health nurse in every middle school. And we did not request any FTEs for that. We did it with our own reallocation. Okay, Social Services Advisory Board. I don't see Brian here, but, oh, he's online. Brian Marroquin is our Social Service Advisory Board Chair. This was established by the directors of the social services programs in our department in 2024. It's required by county code. We were out of compliance with that, but we now have a board of 5 people, all people with lived experiences, all people who know what our business is like, and they are identifying and addressing social service needs throughout the community, and then advising our department on where we should be prioritizing our resources. Now I will hand it over to Deborah Warren.
Thank you.
Want mine?
Oh, thank you. Thank you. Appreciate it. All right. I want to highlight our school mental health program. We were thrilled, and I think APS was thrilled, and our community was thrilled when you all appropriated funding for 4 clinicians a year ago in response to substantial concerns about youth mental health and substance use. All of these positions were expeditiously hired and onboarded. under the leadership of Tabitha Kelly and Jamie Prendas. Our school-based mental health program is now providing behavioral health services in 7 schools, including 4 high schools, 2 middle schools, and 1 elementary school. 131 youth have been served to date. 80 are currently being seen. Our show rates have increased relative to office-based appointments, which shows that this program really works to eliminate barriers of transportation, I'm too busy, and so forth. So we're thrilled about that. Our Aging and Disability Resource Center. This is the area that connects older adults and those with disabilities to supports that stabilize their care, nutrition, housing needs. This office has seen a 60% increase in client contacts since 2021. So last year, there were over 11,000, nearly 11,500 individuals seen, and they have seen an alarming increase in older adults facing homelessness. Last year, 217 older adults were referred for shelter, many of them with complex medical needs that could not be met by our current shelter services. Our RAFT program, which is a longstanding regional program that supports older adults who are coming out of state psychiatric facilities, developed a new program, Dementia Services, which supports individuals and their caregivers with dementia in their home so that caregivers can maintain a loved one at home for as long as possible. This is a new program developed with state funds, and they have served 172 clients in 1 year, provided outreach to close to 500 organizations, and 88 trainings for 2,100 professionals. So this is really exciting and little advertised, but a key component of our continuum of care for older adults. And then finally, ARI, Arlington Addiction Recovery Initiative. I know you've heard about it. It is a nationally recognized program. It's award-winning. Our collaborative stakeholder group grows every year. It's been in operation since 2017. They have worked tirelessly to reduce the number of drug overdoses with harm reduction strategies and Narcan saturation, including opioid emergency boxes in every middle and high school, the libraries, parks and rec centers. Kids are allowed to carry Narcan in their backpack. It's a policy change at APS, which is extremely helpful. We have wide distribution of fentanyl strips, just a ton of training, and vigorous and successful post-overdose outreach by peer specialists with lived experience. And as a result, fatal overdoses have dropped 64% from a high of 2021 when we had 28 fatalities. Last year, we saw 10 fatal overdoses. This year in 2025, we've had 2. While 1 death is too many, ARI's collective impact is absolutely saving lives. Next slide.
Next slide.
Youth.
Okay. I'm here to give an update on some of our youth programs. You've heard about mental health services in the school. Last year, we were given some funding by the board to carry out some ACEs awareness and training. Basically, we are, the staff of the Child and Family Services Division is leading this effort. They have engaged in community capacity building events all across Arlington in many neighborhoods and have reached to about 841 residents. Project Family, which is a early childhood program for largely immigrant families that provides parenting, skill building, that reached 220 families. And we've also produced a number of harm reduction PSAs that have been broadcast on local media, both commercial and our own. And we are in the process of hiring an ACEs coordinator so we can continue to be doing this in a vigorous way. Just to give you a glimpse on childcare, you know that's always a hot topic. Thanks to the board, we had $5 million of local funds to provide both affordability and improvements in quality in childcare. 4.5 was, 4.4, I should say, were awarded to 5 childcare providers for capital improvements to support 136 new affordable slots for up to 25 years. That totals 1,208 new slots over the next 25 years. 0.6 million is still out as part of a NOFA. RFPs have went out, proposals have come in, and they're being reviewed. Those are for smaller grants to increase quality and accessibility to our family daycare home providers. Also, our numbers of people on receiving child care subsidy from the state have gone up. We have 512 right now. 114 are on the wait list, but we expect to be getting the go-ahead from the state to move those off the wait list imminently. And we produced an updated risk and reach study, which you all have seen. On top of our own child care initiative, there's Ready Regions. Ready Regions is a state-mandated initiative, and we are part of the Capital Area Regional Ready Regions group. The Fairfax County is the lead agency. They have several initiatives that we must participate in. VQB5, which is Virginia Quality Birth to 5, aims to improve the quality of classroom instruction in every publicly funded classroom. That means our staff goes in and observes 325 classrooms twice a year. And that includes the schools, that includes Head Start, that includes all the subsidy programs. It comes out of our Child and Family Services division. We have not received sufficient funding from the state. You provided some last year, and this in FY26, we are requesting additional because classroom observations cost quite a bit of money. We also are required to now produce a coordinated enrollment system, which we are not sure how we're going to do, right, Maureen? Because it involves APS's enrollment system, Head Start's enrollment system, and our subsidy enrollment system that are all supposed to come together to provide one unified access point. And then we have mixed delivery, which is another program to provide subsidized slots for Arlingtonian daycares. The Youth Wellbeing Plan, coming to a theater near you. This is, you all last year, of course, you know we had a lot of community engagement around youth. And we don't have a sort of unified view about what we should be doing across the county to serve youth and their families and how to support them. Sure, APS does their role. We have our own programs. Lots of nonprofits have programs, but there's no unified plan. Some jurisdictions do have these plans, like Alexandria. Arlington does not. So we are embarking on building a plan that will connect all of these agencies with a very prominent youth leadership role in the development and implementation, and trying to create another roadmap of what our community should have to be more youth responsive, identify our inventory of what exists, what's missing, and provide some guidance to the board on where we think this should go. There we go. Deborah?
Okay, yeah. So I'm just going to talk about our diversion and jail-based services because that's often a hot topic in this community. We are pleased to inform you that our mobile outreach support team, which started a year and a half ago with a federal grant, has been a big success, well received in our community. This is where a clinician and a peer specialist go together out into the community in a van and do outreach with individuals who may be in psychiatric crisis, who may have other needs or behaviors that might lead them to be arrested. We applied for a state Marcus Alert grant, $600,000 a year in ongoing funding to be able to cover the federal grant when it expires at the end of this year, but also to add a second most team and purchase a new van. So we are beginning this effort. We've hired the staff, and we are about to launch expanded hours in April. So the most team will be in service, available Monday through Friday, 8 a.m. to 9 p.m. And we are working closely with our police partners to hopefully initiate a co-response pilot this spring to ensure collaborative response to individuals who are in a behavioral health crisis. This is rooted in our vision, mission, values for social justice, and it's another approach to get individuals in crisis the help that they need and divert them from the criminal justice system. And then, with regard to our Crisis Intervention Center, which is our crisis receiving center for individuals who and family members can walk in, police can do drop-offs, we have recently successfully implemented transfer of custody of individuals under emergency custody order from police to certified special conservators of the peace. These are individuals who go through quite a training process and certification process to be able to perform in this function. And in the last 2 weeks, we are so excited to report that we had 6 successful transfers of custody, saving an estimated 155 hours of police time, which is valued at $12,400. So we're looking forward to this collaboration continuing this year, and we'll be reporting back on progress there. Also at the CIC, we now have nurses 24/7. Took us quite a while to get there. But just in the last 2 weeks, we have conducted 20 nursing assessments. And as you can imagine, individuals in crisis often come in with health needs that have gone unaddressed. So we've actually identified some significant issues, and we work, of course, very closely with VHC on those individuals. We're also collaborating with Fire EMS and VHC on a number of things. One is moving towards having medical clearance at our Crisis Intervention Center so that individuals can avoid going to the very crowded emergency room at VHC for that service. And then I wanted to talk a little bit about our jail diversion efforts. We have a number of programs in that area. We have a very intensive recovery court, formerly known as drug court. I really like the name recovery, much more positive. It's a very intensive program that requires a lot of staff time, not just DHS staff time, but the time of our partners in terms of, community corrections, pretrial services, the court itself, and so on. This is post-disposition, and if an individual successfully completes recovery court, they could get their sentence dismissed or reduced. Lots of incentives, very intense, 5 phases. And you can see that last year we served 33 individuals in recovery court, and that at the end of the second quarter, we already had 22 individuals served. So those numbers are going up, which is the right direction. A good portion of these positions are supported by grants through the Department of Behavioral Health and Developmental Services. So we've had recovery court for quite a while now, I don't know, at least 10 years, if not more. But in 2021, in response to community demand, we developed our behavioral health docket. The community also really wanted both services, both pre and post plea. And as it transpires, primarily we serve individuals who are pre-plea, which is good. So this docket is for individuals who are arrested for either a misdemeanor or a felony and suffer from a serious mental illness or a developmental disability or duly diagnosed. It's voluntary, court supervised, and again, like Recovery Court, is a very intensive model, 5 phases, lots and lots of staff time. I just wanted to say, I know there was a question about our future plans. We have already expanded the behavioral health docket from a 10 participant cap to a 15 participant cap. And our ability to go above that is really dependent on the acuity level of the individuals, where they are in their phases, capacity of existing providers, for when they are released from the program, and those on the pre-plea. So, okay, we have other diversion programs such as magistrate post-booking project, bond diversion, court-based diversion. And I just want to mention briefly that we have our Mental Health and Criminal Justice Review Committee, which is a stakeholder group of all the professionals who work in this space, meet every month and have just developed a strategic plan based on the sequential intercept model. Can talk more about that later. Okay. Anita? Oh, it's me.
We're going on to performance management.
So Anita mentioned when she was discussing the strategic plan, our PMP, so that stands for Performance Measurement Plan. This is based on a results accountability performance measure framework. And I want to just toot Anita's horn because she's not going to do it, but no other human services agency nationally has this comprehensive framework to assess not just outputs, but outcomes. So this is really, really significant. And for the past 16 years, PMPs have become a robust part of our culture. So robust that we take it for granted. Staff look forward to presenting the outcomes every year annually to leadership, to the steering committee, which involves all levels of leadership. As you can see, 90% of DHS programs currently have a performance management plan, and 90% of those disaggregate data by race and ethnicity. Why is this important? Because when we look at results, we want to know not just the number of people we serve, although that's important, but it's not enough, how well we performed the task, the quality of the service, that's not enough. In addition, we want to know, is anyone better off? Who is better off and who is not? And what do we do about that? How do we adjust our services? So we do this across the board, this is really critical for us in guiding our decision-making, tracking milestones, communicating about our performance, and identifying areas, as I mentioned, for improvement, and creating a culture of accountability. So the final PMPs can be found in the relevant budget narrative, so look for them. The next slide is an illustration of one PMP. This references our Developmental Disabilities Support Coordination Program. Active support coordination is for individuals who are on a developmental disability Medicaid waiver, which funds the breadth of services. And monitoring is for individuals who are receiving IDEA services through APS, receiving CSA services. They might be eligible for a waiver, but not there yet. And so that's just to explain what that is, because people often are confused about that. What I want to show you on this slide is that if you look to the estimates for FY25, you can see that our numbers are increasing. The number of clients that we're serving both in active coordination and monitoring are increasing. And this year, we expect to receive 34 additional Medicaid waivers. An average caseload for a support coordinator, by the way, is 25. So that's, you'll see in the budget proposal that there is an allocation for an additional position in that area. But I want to call your attention to the right side of the slide. The bar graph shows us the race and ethnicity breakdown of clients receiving active support coordination, that's in the blue, relative to all Arlington residents, okay? And if you take a look, you can see that slightly more persons of color are served proportionally. And if you look at the outcomes, you can see down below, our goal is that persons with developmental disabilities have competitive integrated employment with neurotypical individuals. Our goal is 50% of our clients are in that, who want employment are in that space. This year, we're closing in on that goal at 45%. Another critical goal is that persons with developmental disabilities are maintained in non-institutional settings, like home, like a group home, an independent apartment, as opposed to a training center. You can see that 95% of all of the persons with developmental disabilities that we serve live in our community. And the orange block will show you what are our next steps in FY26 based on the data that we've seen. Anita?
Great, thank you so much. Okay, we're now into the numbers section of the budget to just give you an overview of where we are with the proposed budget in FY26. It is $203,844,435, an increase of over 5.3% from fiscal year 25. Our revenue has correspondingly increased slightly over 3.5 million, a 6.9% increase. Our FTE count is going up to 819.72. Don't ask me how we have a 0.72, because I cannot explain. But some of we have new positions that have been provided through grants and other revenue, and there's some that are offset then by the reductions that we're taking, which we will detail in the following slides. Next slide. Okay, these are all requests for additions to our budget, and I don't think any of them come as a surprise. AFAC, we do have a formula for how we adjust AFAC's food budget annually. We've applied that formula. The elevated cost of purchasing food and the elevated number of visits will require an additional $279,000. Culpeper Garden, and we're accompanied here by Martha Hill Gray, is requesting one-time funding of $350,000. The cost of providing assisted living, I don't have to describe to you what that's like if you've ever had a senior, a loved one that you're taking care of. And quite frankly, these are vulnerable low-income seniors who do not have the means to pay for their units, so Culpeper has to find a way to subsidize. And the county does contribute on a regular basis around $800,000 per year, but this year we believe that they can really benefit from a one-time infusion of additional funding. Meals on Wheels, likewise, there's increase in hunger in the community, so we have an increase in number of clients. We also have a vendor who provides better food, so people like it. So we are requesting an additional $105,000 for that. The DD specialist Deborah just described is the one FTE to support the new Medicaid waivers that are coming on. The cost is offset by Medicaid revenue. The child care licensing system is the first ever child care licensing system because all of our licensing has been done on pen and paper. And so we got some money from CIP to do an RFP. Glenda Pittman and Tabitha Kelly led that effort, and we procured one, but you have to pay for the system once you have it. And this is the cost for this coming year, $358,000. Of course, we hope that will provide better management and more transparency for the community. And then there's the VQB5, which I mentioned before, which includes 1 FTE and increased non-personnel costs for classroom observations. Next slide. A few more items, which we'll get into greater detail when we go into the housing presentation, but housing grants, if maintained as it is, will require an additional $2.4 million. A housing grants navigator is scheduled for 6 months. That's a person that would help housing grants recipients actually identify units, which are hard to come by, and typically they have to go through about 10 units before they get one. It's like a 10-to-1 ratio. Shelter costs are going to be increasing due to the awards that are about to be made because we had an RFP for 6 different components of shelter contracts. We had the Homeless Services Center, the RPC, Sullivan House, Street Outreach, Family Overflow, and Arlington Mill, all in that. And some of those items were never competitively bid out. Like Sullivan House, that was on a board award since, I don't know, more than 25 years. So those are projected increases. We also have the conversion of 4 public assistance benefit specialists, which were provided as overstrengths. Now they're going to become FTEs, permanent FTEs. We really need those, and we're very grateful. We need to stabilize our public assistance staffing. There's a lot of turnover, and the caseloads are very high. And the contractual CPI increases, those are from, the CPI that's embedded in multiple contracts. Next slide. Now, here are the detailed of the proposed reductions. And again, in the housing grants, in the housing presentation, we will talk about eviction prevention, where we do, with the new eligibility criteria, we would save $1.1 million. Developmental services, the staff has worked diligently. LaVoice Reed and Jim Baker and Maimuna Ba. We moved all of the folks who were on private transportation that we could to public transportation, and we freed up $300,000. The Community Health Protection Bureau Director is an FTE in public health, a long-standing employee who's in drop. Her position has become redundant because we have a new assistant director that was put in under Ruben Varghese, and she will be on with us through June 2026 when she exits drop. There's an elimination of an employment development specialist in Arlington Employment Center, which is one of 2 positions that organizes recruitment fairs, but we do believe we can continue to provide robust services in joint activities with our Alexandria partners and AED. Next. We are eliminating a risk communications epidemiologist in public health. This is also sort of a redundancy. We already have multiple people devoted to communications in public health and otherwise in the department. And we are proposing to reduce an employment services specialist in child and family services. There has not been a lot of demand for those services, and since we have outsourced our WIOA youth and young adult employment programs to SkillSource, we believe they can be served that way. So that's a savings of $55,000. And that concludes this portion.
Thank you, Ms. Friedman. I would proceed now with hearing from our commissions. I have a list of commissioners present or virtually present with us. I would start with the Commission of Aging and thanking again everybody for taking the time and participating in today's session. Mr. Clerk, is it virtual or in person? Commission on Aging, Ms. Way. Mr. Way.
I saw William come out on the.
Yes,
He was on the.
I'm here now,
Way,
sir.
we hear you.
All right. Well, great. Thank you so much. Good afternoon, board members. It's my honor to testify for the second year. I am William Way, Chair of the Commission on Aging, and we have 2 minutes, so our concerns are food and shelter. I want to start by expressing our gratitude on behalf of the Commission and the 38,000 older adults in Arlington for your support. Your commitment to addressing the needs and concerns of constituents is appreciated and has made a positive impact. During this time of federal uncertainty, we all know that any cuts, reductions, or freezes to the Older Americans Act, Social Security, Medicare, or Medicaid will have devastating impacts on older adults. We rely on these programs, worked hard, and paid taxes for them. So local support, now more than ever, is even more vital. Arlington is leading the way as an age-friendly community. The Arlington Agency on Aging within DHS provides service and support mandated by the Federal Older Americans Act. Again, our concerns are food and shelter. First, food. Our Meals on Wheels program provides homebound residents with reliable access to nutritious meals. The projected budget gap, as you heard, is $105,000, so that means a loss for 20% of the current population who receive the service. These are homebound older adults, or 34 individuals going potentially hungry without meals. Next is housing. Affordable and accessible housing is insufficient to meet needs, just like everyone else for older adults, resulting in an upward trend of unhoused older adults and an increase in older adults in shelters. Arlington leads the region with 2 affordable assisted living communities, Culpeper Garden and Mary Marshall. But cost increases are making it hard to maintain those communities. So food and shelter. In closing, our older adults and the Commission thank you for your leadership and for being a voice for the people. Your efforts in supporting older adults and aging services have been particularly commendable, and we are grateful. Our next Community Engagement Forum is this coming Monday, March 17, at the Macedonia Baptist Church, 22nd Street South, 9:30 to 12:30. We invite you and look forward to your joining us. So thank you very much, and I will also be submitting a letter for your consideration. Thank you.
Thank you, Mr. Way. I have 2 more commissions here on the list. The Social Services Advisory Board that Mr. Marroquin
And Mr.
is
Chair,
online.
Mr. Chair, if I might, the representative from the Commission on the Status of Women has to leave at 1:55.
So then-
if you are amenable, we might start.
Then if Mr. Marroquin is okay, we can take this testimony first.
That'd be Ms.
Okay.
Ms. Johnson.
Who is with?
Hi, it's Arbara
Yeah.
Johnson with the Commission on the Status of Women. Thank you, and thank you to my colleague. I'll keep it very quick. I, like my colleague, want to commend you for standing strong for the values of human rights and equity, and just reiterate that now is not the time to pull back, including and especially on the issue of gender equity. We would like to thank the board for continuing to invest in child and elder care, specifically the child care license system we just heard about, the Virginia Quality Birth to 5 program. Child care is consistently one of the top issues that women in Arlington struggle with, women with or without means. And I would also finally just like to ask that you continue your commitment to menstrual equity. Inflation is hitting everything. It's only getting worse, and menstrual products are definitely not an exception to that. I know that, and I want to thank you for your commitment to retrofitting county buildings, the bathroom machines, so that period supplies could be available free. I understand that investment, the retrofitting itself, has been pushed a little bit back to Q4. We would just like to encourage you on behalf of women and girls in Arlington to make sure that happens. It's a small investment, but it really it's a visible reminder that you as a county board care about women and girls and equity. So with that, I also would like to invite you all to our Women of Vision ceremony on March 25th in the evening. And we'll look forward to perhaps testifying in more detail on March 20th. And thank you, Mason, for putting up with our shenanigans. I'm substitute teaching pre-K. Our commission chair is a federal employee, so there was a lot of thought put into this testimony, which perhaps is not reflected in the 2 minutes. But thank you all.
Thank you, Bora. We fully understand. I should also say that on the 20th of March, that's next week at 5 p.m., commissions have an additional opportunity to weigh in on the budget, and this is an open meeting, an open work session for all commissions. So there is a second bite at the apple. We should be continuing now with our Social Services Board, Mr. Marroquin.
Yes, good afternoon.
Yes, here you are.
Great. I'm Brian Marroquin. I'm the chair of the newly formed Social Services Advisory Board. Our charge is to provide input to DHS on policy issues and to serve as a resource on behalf of residents to improve public benefits programs. Specifically, our focus is on Virginia Department of Social Services, or VDSS funded programs. So that includes SNAP, TANF, Medicaid, the Child Care Subsidy, Child Protective Services. I could go on, actually. But more importantly, what we're focused on is bringing that experience from community members that have lived experience. And at our last commission meeting, we asked ourselves which public benefits programs are most at risk, what happens if they're significantly reduced or cut, and what is the county's process for equitable input on how we should respond to these possible cuts. And so while we started discussing individual programs, what emerged from our discussion was how interconnected these services truly are, how a change in one can have a ripple effect on another, and how childcare is infrastructure, how cuts to Medicaid threaten not only a person's health, but also our overall economy in Arlington, given that 2 out of every 3 Medicaid recipients is part of the workforce. We also discussed how important it would be for community members to be able to count on competent, responsive, and empathetic guidance to provide good information as things change all around them. So that could be caregivers advocating for a family member who is trying to make sense of their change in coverage, or immigrants hearing the rhetoric from the federal government and fearing that asking for any kind of help in Arlington could make them a target of immigration enforcement. And increasingly, this will include federal workers and contractors who now find themselves on shaky ground. So to respond to the moment, we're grateful for the step you took to add those 4 staff members to the Public Assistance Bureau to respond not only to a large increase in demand, but also to the quicker turnaround times mandated by the state coming out of the pandemic. And more help will be needed, so we urge you to monitor how this is going and always strive for not only improved customer service, but also enough support so that staff don't burn out right when we need them the most. So we're looking forward to monitoring the development of the budget and providing feedback on these VDSS funded programs. And the next SSAB meeting is on April 22nd at 6 p.m. Thank you.
Thank you indeed, Mr. Marroquin. A question for our clerk. Is Ms. Green from the Community Services Board available right now? She said she would be at 2 p.m.
It's going to be Ms. Crawford.
Okay. I had a different name on my list. Yeah. Thank you for that. Good afternoon. Can you switch on your, yes, that's now
Thank you.
working.
Okay, thank you. Good afternoon, Chair and members of the board and county leadership and DHS leadership. I appreciate the opportunity to speak today. I did already submit a letter, which I hope you received, but I'm Wendy Crawford, and I'm the Chair of the Community Services Board. So I'm here today to personally share our appreciation and support for the county manager's proposed budget. The CSB notes with gratitude that you all started the budget process with a direction that included the phrase responsive to the needs of our most vulnerable community members, our most vulnerable residents. That really resonated with us because that is our primary function, is to support DHS through policy and performance reviews in that work. Our letter highlights some of the programs and staffing that are responsive to that budget direction and which are aligned with our priorities as a Community Services Board and which you heard about in the presentation today. So I won't review those, but rather I'd like to use this very short time to add further context for you. I know not everyone is familiar with the Community Services Board and their role. You're probably aware that that board is mandated and it does have specific responsibilities in the areas of performance and performance contracts and policies. But I would like to give you a little bit more salient details about the board. When the board is fully at full membership, we are 18 citizens on the board. And each of those represents one of 4 areas of interest. That's child and family services, developmental disability services, mental health services, and substance use disorder services. Each one of those areas has its own committee with further members of the community as their membership. So we have quite a breadth of representation from the county. People tend to gravitate towards us or come into our committees and our board because of personal experiences and lived experiences, some of which have been challenging or difficult. And they often arrive at the full board with a lot of knowledge, experience, and passion. The work at the board is to hear those concerns and to shape a consensus that we can then bring forward to leadership like yourselves, DHS, to make sure that those needs are heard, but that what could be a competitive situation is dealt with in that forum so that we're a unified front. So we want to today support the budget as it is proposed and let you all know that we're also here to support you in your leadership role and that the CSB will continue to be fully engaged and vocal in supporting your stated priority to serve the most vulnerable of our community. We do recognize that these are challenging times in multitudes of ways, and that difficult decisions must be made. In reviewing the county manager's proposed budget, the CSB offers appreciation and support. Thank you to Mr. Schwartz and the Department of Management and Finance for the budget proposal and the opportunities for engagement and the accessible presentation of the budget. And in closing, I'd like to express special appreciation to the staff who support the CSB committees every month. They are at our meetings, all of the staff that provide services to our clients, and lastly, a deep gratitude to Anita Friedman, Deborah Warren, and Ollie Russell. These leaders provide continuous support, expertise, insight, and open communication to us as a board, which really helps us, and we appreciate your commitment and collaboration. Thank you.
Thank you, Ms. Crawford. You can stay if we have questions. I mean, you've raised issues of it, but of course. Be comfortable. Colleagues, the discussions with us, we allotted about 30 to 40 minutes to this part of the program today. So I would start, in successive rounds. Are there any questions or comments on the department overview and the strategic plan areas that we see? Ms. Coffey.
Perhaps not a direct question, but actually for the manager and DMF. One of the parts of the proposed budget is obviously adding to our stabilization reserve fund. I think there is a lot of legitimate concern about a number of the programs within DHS that could have their funding from other sources removed or drastically decreased. Is the stabilization reserve something that we can use to at least temporarily bolster these programs? I know that there are some restrictions on that fund, but I just, I think there's a lot of anxiety around these kind of basic needs supports programs, and I want to make sure that we have our worst case scenarios somewhat covered.
Mm-hmm. Short answer is yes, given that the fund is set up to deal with unforeseen economic contingencies. And also, I think Anita may want to comment a little bit because you've done some work on our exposure on the federal funding level, so I don't know if that's appropriate to ask her to do that.
If you would like.
Well, I think there's a real concern out there about the potential for cuts to the federal programs, and rightly so. And we did do an analysis within our department, and there's approximately, I think this is also in the written form of the budget, slightly over $42 million of funding comes into DHS through federal grants or state pass-throughs from everything from Department of Justice to Department of Agriculture, Department of Education, Health and Human Services, so it's very widespread. Also, we have the single largest program of our department is 100% federally funded, which is the Housing Choice Voucher Program, which is now about $27 million, if I'm correct. And of course, we also, something else to put into the hopper is the amount of money that many of our nonprofits receive through state and federal funding, including HUD grants and state VHSP and the Housing Trust Fund. And we calculated that to be about $3.5 million. So there is a potential for a significant
Disruption.
disruption. That's the word. Disruption.
It's the polite word. Actually, it's an underwhelmingly polite one.
Yeah.
So, Ms. Prokofy.
No, thank you. And thank you for doing all of that pre-work. I think we're doing our best to plan for very uncertain times at this point. And, we had a worker resource fair this weekend. The two number one things that I heard from people that were concerns were housing, which we'll talk about in a little bit, so I'll hold off on that. And then actually health insurance. There's a lot of concern around health insurance for people who have had employer-sponsored plans through whether they're a contractor or a Fed directly. And so I think I would just highlight that as an area of increasing need, perhaps. If you've thoughts.
Yeah, no, I was just discussing we had some DHS folks here, and I was discussing with Lynn Porphyry, really the folks who are being let go from federal, they have never faced this kind of uncertainty. It's really, I think, a big shock. There's a lot of stress and anxiety. They did mention housing and healthcare, and we do, as a normal part of our business, help people with the federal health exchange, when they're eligible to go through that exchange, and that won't change. But we don't, there are going to be needs out there that I don't think we'll be able to meet.
All right, and I have other questions, but they're more topically specific, so I guess I'll pass along for now.
Mr. DeFerranti.
Thank you, Mr. Chair. First, I just want to thank you for the work. The ongoing work is not inevitable, and I'm grateful for both of you so much for the work, as well as all the staff who's here, and line staff underneath you who are here in the audience are the ones who are directly trying to help those folks who are most in need. I'm grateful as well to one of our providers, Ms. Ortiz, for being here, and we'll talk more about homelessness in the other place. I think keeping in mind the different buckets, your key data has 29,307 Medicaid recipients. And there are different ways for counting the number of low-income Arlingtonians. But those individuals are not in this room. And as we think about this, and as you do, and as our community sort of grapples with the challenges of the federal workforce and our economic situation, we need to also be thinking, I believe, of those people, keep them in the room, because that's what we're, as a community, we try to be inclusive and value every human being. And there's 29,307 heartbeats out there that are dependent upon Medicaid, and some fraction of those are getting SNAP, and some are getting housing choice vouchers. And so that's plenty for me, but I'll have a lot of other questions. I think they fit most neatly in the other buckets, but I did want to ask all of us in the room to put those people in the room.
Thank you, Mr. DeFranti. Mr. Spain.
Well, Tanita and Deborah, it's great to see you. Today is day 70 for me. People ask me, JD, you still counting? Yes. Thank you for the work that you're doing, one of the largest departments here in Arlington County. I do want to, when you think about over 100 services, human services that you lead, that is significant. So I want to direct our attention real quick to slide number 9. And if we can pull that up. And I'm glad we have 40 minutes, Mr. Chair, because I'm sure everyone has questions. I just want some clarity here. When we start talking about our MOST team, all the way to the left, that top bullet, I just need some clarity. Establishing a second team with expanded hours Monday through Friday, 8 a.m. to 9 p.m. and added a new specialized van. I just want to get an understanding, it's not 24 hours, right? So what is prohibiting us from going to 24 hours?
Well, that would be the ideal in the future. But what we did when we started the first MOST team, Mr. Spain, is we looked at the data in terms of when the emergency call center recorded the most behavioral health calls. And we also looked at our own emergency services and looked at the peak volume times and determined when to deploy the initial MOST team. And that team works from 1 p.m. to 9 p.m. But when we looked at the data, we saw that mornings were also an unaddressed demand time, particularly with our police partners. And so that's how we determined those hours. Should funding be available in the future? Absolutely, we would go to 24/7. But as it is, it's really, we do have 24/7 behavioral health emergency services. And it is very challenging to keep those programs staffed, as well as our jail staff, which also works extended hours and weekends.
Yeah. So just so you know, I'll be fully supportive of some venture in that road because, mental health and these type of issues don't stop during them typical working hours. So whatever we need to do in the future to get to some type of 24-hour model, I think will be appropriate. I also want to commend you what you've been doing with student mental health in that area. I see that some of our numbers, when we talk about even our fatalities in Lawrence General, that 64% percentage, it tells me that you're doing really good work and putting in some good measures. I know my colleague is going to have some questions, but I have one more here, and this is actually going to go to, I think we're talking about slide 15 right now. And where we're going to be talking detail of proposed reductions. First, I've heard some conversations in my short term here about this reduction in transportation budget, the $300,000, okay? Can you talk more about, I know you're saying you're going to use some more of our services that we already have. What are we taking away? Because I don't want to get in front of what some folks have already told me that is missing, but what are we taking away?
Yeah.
So,
Deborah has some more details.
yeah, historically, we had a number of clients who were not on Medicaid waivers, and they received locally funded transportation through Diamond vendor. And our budget at that time was seriously about $1 million just for that piece. And, but then as the state began to fund Medicaid waivers, it's a complicated allocation process, but we usually find out mid-year how many waivers we're going to receive in the next year, and there's a long waiting list for individuals who need those waivers. And then there's a process of prioritization, who gets those waivers. So we realized, I would say about, 3 years ago, that we had a number of individuals, close to 100 individuals, who were receiving locally funded transportation who could be served with publicly funded transportation. And we...
Through the Medicaid waiver.
Yeah, through the Medicaid waiver. And we discussed that with the Developmental Disabilities Committee of this Community Services Board. And to date, in the last couple of years, we've transitioned 70 individuals from locally funded transportation to Medicaid-funded transportation,
gotcha.
saving the county about $600,000. And then this is for another, I think, 30 individuals. And when I say publicly funded transportation, it's Motive Care, Star, Metro Access. We also have a program, and we have retained dedicated funds for this, where the family can transport the individual to their day support program or their employment program and get reimbursed.
Yeah.
So,
I'll come back and have some additional questions. I will just tell you that I've heard some concerns about the level of service when we moved from one platform to the next, especially utilizing I won't call names, but a different service that even with persons with disabilities, that the same level of service.
Yeah.
Okay, so you've heard about it as well.
Yeah, sure. We receive all kinds of feedback from
Yeah.
the community. And in a few cases, there were glitches, and we have worked through those glitches.
Okay.
Because people can argue, sure, it sounds, when you go to public, it's got to be worse, right? I mean, that's sort of a common notion. But the Motive Care actually is like a private service. It's just they accept Medicaid, but it's still a van that comes to your house or very close to your house. It's not different than what was before.
But if that service is not prompt, if that service, we can talk later. You and I
sure.
both get it. I'll turn it over to the rest of my colleagues and I'll circle back. Just know that I love the work that you do. I'm fully behind DHS and your programming, and because you're into the people's business, right? And that's what I'm all about. So I'll turn it over to my colleagues, and then I'll probably come back with another question later.
Thank you, Mr. Spain. I would also want to point out that we have an ongoing audit on STAR that reveals a lot of, the performance parameters of these publicly funded services. So this will be interesting. It comes a little bit later this year. Ms. Cotton.
Yeah, just to tag on that, I think lifting up that question of not just level of service, but the appropriateness of service, making sure that, I think we heard a couple that there wasn't a wheelchair accessible or not properly, fully the big wheelchair accessible. I'm sure you've heard it too and are working on it, but want to raise that up. Similarly, when we were here a year ago, we were worried about that transition. We were also worried about the behavioral intervention services transition, and I wondered if you could give us a little bit of a snapshot of how that went and whether there's any ongoing costs or needs there.
But we have not received any concerns voiced by community members. We have other kinds of parenting programs offered through the Child and Family Services Division. Project Family is one. Flip It is another. I'm probably forgetting the names.
Parenting Wisely.
Oh, Parenting Wisely. So we have been offering those kinds of programming to folks who are interested in
Great.
parenting skills.
Great. And then pivoting to our health category, two things. I think public health in a realm that is different than a year ago in terms of vaccines, measles exposures, avian flu, et cetera. Can you share a little bit about how we are standing ready as a locality and perhaps as a state to respond to those? Are we still doing wastewater treatment? Or do we have any worries about measles, et cetera? Not treatment, sorry, wastewater monitoring.
The wastewater monitoring is, I don't think is within our purview, is it? No, it's DES? Yeah, but we have recently, we've done this over the years, but every time the period comes up, we become reaccredited by NACCHO, which is a national accreditation organization for public health readiness. So we achieved that recertification in September. The Virginia Department of Health is not yet talking about measles.
It will be soon.
No, they are not. But we have,
Landed in the airport. They just landed in the
Dallas.
airport.
okay, well, come on down, folks, we'll take care of you. But, just joking. We have always prided ourselves on the readiness to disperse medicines and disperse vaccines and disperse whatever. And we've done it over years with H1N1. We handled Ebola. We handled monkeypox. We handled COVID. And so HIV, well, yes. So the staff is very prepared to, basically, given whatever evidence we have a communications staff who can reach out to the community. We have the ability to mobilize the Medical Reserve Corps, which are the volunteers who basically will go vaccinate and do door-to-door distribution of materials if necessary. So I'm not worried about that. Sure, it would be good to have a public health director in place right now. That announcement is coming out on Friday. But we feel that we would be able to handle that.
Great. And then secondly, on urgent care, we hear both from our hospital partners and from our free clinic partners that need for urgent care, particularly for Medicaid or low income or uninsured, is needed. Are we filling that need in part through DHS, or are there investments we should be considering now or in the future?
Well, Arlington County has never provided direct primary care for low income or uninsured. Mm-hmm. That decision was made, I don't know, many moons before I arrived. We have offered specialty care for things like dental, family planning, sexually transmitted infections, tuberculosis, HIV, those particular areas. With regard to primary care, we do have now, neighborhood health is in our building, operating a full clinic on the second floor. We gave them a whole section of our floor. So they do accept uninsured and insured. And of course, we work closely with Arlington Free Clinic. And the hospital still has its outpatient clinic for uninsured. But we have never been in the business of providing direct primary care. That was a decision, I don't know, Mark, remember? Before your time, too. Yeah.
No, we don't have a county hospital, this is why.
Sorry?
We don't have a county hospital like other bigger counties have, so this is a prerequisite, would have been a prerequisite of that. Okay, before I go to my colleagues back for a second round, I cannot overstate how thankful we are that you're all here and covering a enormous ongoing crisis right now, with not only with the most recent ones, but it has been building up since the pandemic and with the pandemic. So I'm extremely, I have to recognize the not just the work, but the dedication and the mission-centered approach of the department. So thank you for your leadership, and thank you everybody for working so hard on this. I think that Arlingtonians really feel that. I have one question that is keeping me up at night. SNAP. There is no month that goes by that we don't see the demand for food assistance at our local food banks and AFAC and others. So I'm very concerned that SNAP is right now again under pressure for whatever reason. So what is the plan B? What is the expected breakout if parts of that collapses? I mean, 10,000 people is not a minor issue.
Well, we would have to turn to our food security coalition, I would think, and figure out how we could distribute more food into the hands of people. 10,000 people are not easily absorbed. We have a very strong food security coalition. Matt is the liaison, and there are a lot of outlets to distribute food, but it would definitely require a infusion of money and support to be able to enhance the nonprofits' delivery of groceries and access to food.
Right. Thank you. Ms. Coffey.
All right. I'm just noting the time, and so I have many questions, but I will echo the concerns about food security and support, potentially adding one-time dollars somewhere to support additional food security, because I do think that we know is going to go up and be a huge need. I am interested in talking a little bit more about jail diversion, and rather than when it comes to behavioral health or dual diagnosis, thinking about jail diversion for people with crimes of poverty, things like trespassing when folks have nowhere else to go. Do we have diversion that applies in those kinds of cases where someone's not in crisis, they don't need mental health services, but they need, that kind of social safety net support, and they need a place to go and to be connected to other services? Do we have options for those folks?
Well, so we do work. We have our Treatment on Wheels program that provides outreach to persons who are unhoused, particularly those with mental health and substance use issues. We have the most teams, soon to be 2 teams, that goes out. We are working with our police partners really daily, as well as the emergency call center, to identify those times when an individual is trespassing or there's a crime of poverty that occurs, to divert them from being arrested, as well as in the VHC emergency room. We have a designated diversion therapist that was just hired last May. It was vacant for a year, and that caused some uproar. But we have that person on board. We also have a diversion position within our jail. So, yeah, and we work with the shelters.
We'll talk about this more when we get to housing. The truth of the matter is, there are many opinions out there in the community about who should be housed, when they should be housed, and where they should be housed. There is not common agreement. Our shelter capacity has declined, and you'll see the numbers later, because of the family home becoming offline. But, there's also more folks who are homeless who are presenting themselves here in Arlington. And Arlington is in a specific geographic location that, basically people end up coming here from other jurisdictions by choice or by not choice, but it's convenient. And we have always prioritized, at the direction of the county board, to serve people who we know are Arlingtonians first. What does that mean to be an Arlingtonian? Well, if you go to schools, you'd only have to be here one night, right? But with the homeless services, we have put in a criteria that you need to be known to a provider or to the county's services for 90 days. You can come into a shelter, of course, for up to 96 hours, but then we try and place people back in their jurisdictions of origin. This is not a popular view right now with some of the judges and with some of the other advocates. But the folks that we are talking about, number one, the folks who are on pretrial or waiting for that are typically on probation, parole, and we do not have the places to accommodate all those folks, and we never have. Or the services. And the folks who are arrested on nuisance crimes, well, we're trying to work with police constantly about that. You know, we have over 100 and I don't know how many people attended CIT, the Crisis Intervention.
120.
Yeah, we're constantly training folks to try and provide mental health, crisis-informed responses, but we also can't control what happens with law enforcement, so. But there is no place like, here's the place where people who are just picked up go. There's unless they go to the shelter, they can go there during the day, but, you know.
And I would encourage you to raise this point when we have the chief of police here. He has told me, and I've talked to many officers, the last thing they want to do is arrest someone for trespassing. Often they're dealing with business owners who insist, and they try their very hardest, the police, to get people off of their property so they don't have to arrest them. There is some challenges, and I think Richmond is the place to have this conversation about criminalizing the kinds of acts that you talk about that frankly shouldn't be criminalized.
Right.
Thank you. I will mostly leave it there, but I really appreciate all of the work that you and your staff do. I think it's some of the most critical things that local government can provide for our community, and I think it's only going to get more critical over the next months and probably years. And so I just really admire the commitment that you both bring to your department and the perspective of really, focusing on the most vulnerable, prioritizing. And I think we're gonna continue to work through troubling times, but I think broadly, really just have so much admiration for the work that you do. So.
Thank you. I saw the light of Mr. Spain.
Yep. Now, unless the vice chair, he may have, did your battery go dead?
I was a day late and a dollar short. Go ahead.
You're late and a dollar short. Okay, good. Just really quick, and I have a couple of topics here, and I think it can get somewhat elongated. I just want to say, when we talk about direct primary health care, I would love to hear your thoughts. And I hear what you're saying about we don't have that here in Arlington, but I do know for certain from a public health risk perspective, having folks in your community who aren't being seen for the basics puts on a significant risk health-wise to our community. So your thoughts on perhaps later a model that we can maybe look at. There's even early career professionals out there who just don't have health insurance. But how can we give them some very basics at a county level outside of some of the programming you already talked about? Would you be willing to talk about that at some other time with me?
Yeah, sure.
Yeah.
Absolutely.
Thank you very much. Public Health Director, glad to thank Dr. Varghese for all his hard work, but I would love your commitment with the new Public Health Director coming in, make sure they're out in the community. We want to see them.
Absolutely.
Yeah, he, him, they or she. Please get them out there. And lastly, the two things. For the folks that are going to be losing perhaps their jobs or being moved elsewhere, I would love to get some data on race and gender for each one of those positions. Can you present that to me or to the staff at some point in time?
From the federal workforce?
No, your workforce.
Oh,
the
from
FT.
our workforce,
Yes.
Sure.
All I need is race and gender.
Sure, I can do that today.
And thank you. And lastly, for youth programs, before I got here to county, allocated a good bit of money for youth services, and just want to work with you in the future with your youth programming to do more, especially over the next fiscal year, if you're open to it. And whoever's leading that charge, would love to tandem with them to do some programming, some additional programming for our youth, especially with summer coming right around, and just some ongoing programming as we look at to do more in this community, okay?
Absolutely.
So really no questions there, just some thoughts I'm having, and what the future may hold as far as my perspective.
I look forward to working together.
Thank you.
Thank you, Mr. Spain, Mr. Friend, and then Ms. Cunningham.
Thank you, Mr. Chair. With respect to food, I think colleagues know this. Certainly, I will be supporting the mini grants, which would be one-time funding of $150,000. The 270-ish thousand for an increase in the contract working based on the need, demonstrated numeric need. I think I'll just say, and I think others have said, we don't know the level of need, and so I just want to put a pin in the 11.5 million we're adding to the Economic Stabilization Fund. Part of the reason for that is to address the possibilities and the pain. I don't think that SNAP is fully going away, but the history of the federal attempts to ABODs, able-bodied adults, the attempts to cut SNAP are have been going on for decades, and this is a dangerous moment there. So those are a couple of thoughts on that. I was really happy to hear, even though I was sort of head down, I did hear Crisis Intervention Center is working. And I'm mindful that we put a ton of, you, Ms. Warren, we all put a ton of effort into it. And there are little hiccups on the way forward. And I don't mind being honest about those hiccups, but I'm glad that it's working. The large number of hours you mentioned are great. I'm open to a conversation of if it's not working, but I just wanted to note that because it's in the slide deck, one of them. There are about 14, there are 15, there are a lot of new positions that are dependent upon grants. And I just want to sort of ask the question, get a head nod, get your thoughts. Those positions are state and federal grants, I would guess, and they're not to be hired unless we get the funding, right? Okay.
Right.
Great.
We get the
Money in hand.
allocation first, and then we hire.
Great. And I think that's I know we got other things. The Housing Grants Navigator position.
Yeah.
Is it on time? Is it ongoing or one time? Are we holding until January to hire, or what's?
Yeah, we're holding until January to hire. It was recommended in the housing grant study because of the difficulty in finding affordable units. Could be, depending on what the board's direction is, it could be repurposed for wait list management if that's an avenue that the board chooses.
Great, I might want to learn.
Voucher program. With a voucher program.
With the housing grants
With the
program.
housing program. Okay.
Yeah.
Great, okay, thank you. Others have looked in more detail. I guess last set of questions, there are some metrics in here. Auxiliary grants, 805,000 to 1.9 million. Is there anything you can, that's not an insignificant amount, if I'm counting correctly. That's not an insignificant, it's not the biggest program, but that's not an insignificant increase in the total spend there.
Didn't they go up, auxiliary grants? I don't know the exact amount. The auxiliary grants are used for people who are in nursing homes and assisted living.
I wonder if that's impacted at all by Chairdale, but I guess what I think is the best in the interest of time, I'll just try and follow up with you with an email on auxiliary grants, just to see if I'm counting right. There's some metrics, and you mentioned performance management. There's some metrics on substance abuse, suicidal thoughts. Each of these are different. And then there's metrics on child behavior and family, where we've seen significant, like over 20% changes in the metrics. And adult protective services, the number has changed. And are we getting better data? I can follow up individually on those, but I did want to understand if those if there's a pattern there, or is it just individual programs have different things? There's 3 or 4 different areas where the metrics have moved.
Well, sometimes it's a position being filled or being vacant for some reason or another, you know, if someone's on FMLA or whatever, so the numbers might go down, but then the person comes back, the numbers increase. Sometimes it's increased needs. It depends on, you know, what the issue is. Usually in our PMPs, at the end of the year, we describe the changes in the numbers and what the factors are there.
Great. That's enough. I'm
We-
mindful.
Yeah, we do have a surge in cases of adult protective services and adult services. And we had originally put in a request for additional staff, but we pulled that back. But there's a lot of financial abuse, financial fraud and abuse, exploitation and scamming that's going on, and that has been a driver for some
Yes.
of the APS.
Thank you. I don't think I've gotten us too late. We do have to, I think, 2:45, but I yield, and I will say that the fraud and abuse pieces, I do not need another fake text message on Easy Pass, for the record.
Right. Ms. Cunningham.
I wanted to go back to the conversation about youth and the youth strategic plan. Are you able to share a little bit about what's been done so far and what the work plan is? Because I know we are all super excited about that. And as Mr. Spain said, you know, how to connect all the things, all the great things that we do across the county and the schools and the community.
Well, we do have a draft of how to proceed, and we've been socializing that with different stakeholders, with Parks and Rec, with JDR Court, with libraries. We actually had a meeting between, Candace Lopez is the person who's in charge of the youth plan. She's one of our new assistant directors, formerly Project Peace, well, for a little while longer. And so we have basically a roadmap of how we'd like to bring people together, use youth as possibly as student assistants and hire them actually to do some of the surveying of peers. We'd have basically multiple forum of people who are, you know, stakeholders at a leadership level, and then a larger community of people who would be involved in a broader way. We do have a lot of data. Schools has a lot of data, and we really don't want to repeat more surveys if we have the youth results behavioral YRBS. And schools now is in control of what we can ask, so that's an added advantage. But I'm ready to, you know, we have a few more questions, but I'm ready to share it with you whenever you.
Great. I would
Whenever
welcome
you
that.
want.
I know there are probably 4 other colleagues here that are very interested in it as well. And I had one last question. Can I remember what it was? Oh, the other was around employment services. So I know we have a couple of positions going away here, and then we have enormous needs coming to fruition in the community. So the good news is we're all paying attention. But can you give us a little view of how you see us as a county best supporting the very diverse reemployment needs that we are likely to see? And are there consulting dollars already in here? Are there partners that we should be thinking about an RFP with? How do you see us wading into that this year? It's top of mind.
Well, we have, what should I say? And Brooke can probably speak. You want to come up, Brooke, and talk about that? You mind? You can talk about WIOA and our partnerships with the community colleges and Dave and.
Yep.
Yeah.
So in the Arlington Employment, hi, I'm Brooke Hammond Paris. I'm the Economic Independence Division Director. So in the Arlington Employment Center, we have our WIOA contract, so we do get funds through WIOA. So I would assume most of the recently laid off federal employees would be eligible to receive those funds. And then we also receive money through the Department of Social Services for SNAP-ET, which is SNAP Employment and Training. So for any individual ABOD that is enrolled in SNAP, We have 2 staff members who are helping them find employment, as well as View, which is our, oh God, don't quote me on, Virginia something or another, employment and welfare. Basically, it's the employment program for people enrolled in TANF. So we do have those state and federal funds or pass-through funds coming in. We also have local funds to assist with job training. So for individuals that might not be good fits in any of those categories or might be underdocumented, we do have local funds to assist in job training and supports. We have our business engagement team that works with all of the Arlington and Alexandria, because we're the Arlington and Alexandria Regional Workforce Council. All of our business partners, we put on job fairs. We're planning a job fair for May 10th, I believe, at George Mason. Dave Remick is planning that at George Mason University, specifically catered for people who've been laid off from the federal workforce. What else? We are always partnering with the community colleges and different training providers. I think really we are poised to help those that come in through the door. I think historically we have not seen, obviously, a bunch of laid off federal workers coming through the door. We're usually, in Arlington, historically has had like a 2%, hovering around 2% unemployment. So most of the individuals that we are seeing come through the door usually have very high barriers to employment. There's usually reasons that they have been historically unemployed or underemployed. But we do have some capacity to serve people, and we are trying to do proactive things like these job fairs. But our capacity in the Arlington Employment Center has been diminished over the years through different RIFs. So there is that reality as well.
All of those services is for feds and contractors, right?
Yes. Mm-hmm.
Great. I think there's vast community interest in things like the May job fair, and maybe there's a warm-up job fair or even a front door kind of how to access the services. As Anita said, many people have not been in this, by definition, our federal employees in particular have not been in this position because they chose government as a stable place.
Yeah, and I also forgot to mention, we are regularly doing webinars. If you go to the Arlington Employment Center website, there are webinars on how federal or previous federal employees can cater their resume, or what transferable skills are there that they can try to get work outside of federal government. And I think we're having one of them tomorrow. So those are all virtual webinars that are available on the front page of the Arlington Employment Center's website.
Great. And I think as Ms. Coffey mentioned, one of the most frequent questions we've gotten is, how do you access unemployment benefits, and when? Do we have support to help navigate that? Apparently, Virginia unemployment was not answering the phone well last week.
Not a surprise.
Yeah.
So the Virginia Employment Commission used to have staff in our office. They are now virtual since the pandemic. But we do have contacts. We can put people in touch with VEC. A lot of people conflate and think that Arlington Employment Center is the one responsible for their unemployment benefits. So it does have to go through the VEC, but we can definitely help facilitate if somebody's having issues. And I know that we see that quite a lot, people frustrated with, not being able to get through to VEC's offices in Alexandria. And so because we have virtual VEC staff that are associated with our one-stop center, we can put them in touch with them and hopefully get them the support that they need.
And so if an Arlington resident's experiencing that bucket of anxieties, what door should they come in? What is it?
Well, it's right on the main webpage of the county's website.
Just the federal resources.
And then that goes to the Arlington Employment Center resources.
Yeah. Right, so Arlington County landing page, top right, there's a federal workers button.
Yeah.
There sure is. And then they can also come into the office in Sequoia Monday through Friday, 8 to 5. We also do virtual appointments. We have the resource center available that's open Monday through Friday so that people can come and use the computers if they don't have computers at home or internet access at home. So we're trying our best, but yeah.
Great. And then we're hearing lots from folks who are interested in volunteering to support. So let's keep that going so that we can help staff those things out.
That'd be great.
Thank you.
Okay.
Thank you, Ms. Cunningham. There is no doubt the one thing that I've been discussing that also with our colleagues in the region and also across the river. Our first laid off federal employees are actually eligible in the district because this is where their agencies are. And this is by itself a challenge. Actually, they work better in this than we do. One of the major issues that I've been conveyed to is, it is very important to look at the employers, potential employers. They're looking for talent right now, and this is a national issue. That means, state governments, for example, are looking for qualified employees, et cetera. This is a completely different type of a workforce, and I don't know whether we have to hone in our skills to look what exactly fits the task right now. I think we have to accelerate on this as much as possible. Time check, we are a little bit above. I thank you so much for the presentation today. I'm sure that you will be answering also other questions that will be coming through our online inquiries. Thank you, everybody who took the time to attend today. Thank you so much for your work. We are really proud of you and thankful. And we are now on to housing. Ms. Stay right there. Stay right there, Ms. Friedman, and I believe Ms. Venecia will join us. Sure. We have. So we're continuing with the presentation on housing. We have our housing director, Ms. Venecia, here. Ms. Friedman will be continuing.
Yes. Sorry. I'm continuing. So this is a joint presentation between the Department of Human Services and CPHD, who are the two departments that contribute to affordable housing and stability for low-income households in Arlington. We like to refer to housing stability as a three-legged stool because it requires the production of CAFs, which CPHD does and provides a supply of affordable units, rental subsidies, which are provided through Housing Choice Voucher and housing grants, as well as permanent supportive housing, and supportive services, because there are folks who are over 300 who are in permanent supportive housing who cannot maintain their housing without additional support provided by the staff, DHS staff. Next slide. So here we are, housing grants. Housing grants, as you know, is one of the key tools of Arlington's housing affordability. And the growth has been significant over the past several years. It's projected that in FY26, we'll be serving 1,783 households. That surpasses the federally funded Housing Choice Voucher program. Typically, we always had a smaller housing grants and a larger Housing Choice Voucher. There's been 45% growth since 2020, and last year an increase of 6.1%. If this would be maintained as it is, we would require an additional $2.5 million in FY26. That would bring a total of $17.5 million for the Housing Grants Program. Now, I just want to explain for the public why housing grants is needed to make housing affordable. The primary units that are produced through AHEF are at 50 to 60% of area median income. If you're a household of 4 and you make $92,820, you can afford those units. But the typical family that we are dealing with in Department of Human Services is at 30% AMI, which is about $46,410 for a family of 4. So in order to bring the affordability down to where people can really afford it, the subsidy of the housing grants pays the difference. And I'd just like to focus 1 second on the green piece of paper, the green handout. This is a snapshot of who is in the housing grants program. And this is a snapshot taken in February 2025. And basically, you know, in addition to the income requirements, we have working families with children, people with disabilities, and people who are 65 and older. It's pretty much evenly divided. Working families, slightly fewer. Hold on a second. But if you just look at the average annual incomes, we were talking about working families, a family of 4 having basically being at around $42,000. Working families are on average earning $38,000, and also people who are on fixed income, 65 plus, they're making $18,762 a year. They cannot live here without some kind of form of support. The assets levels are minimal. Most folks have less than $5,000 in the bank. And the interesting to note is, you know, people think, oh, housing grants, are people staying on here forever and ever? They don't want to get... No, that's not the case. Of course, people with disabilities or seniors are there longer. But in terms of working families, only 65 have been on the program for 5 years or more. When people find alternative ways to make additional income or circumstances change, they leave the housing grants program. So I just wanted to basically let you know about that. And I also want to let you know that households, on average, pay about 40% of their income towards the housing, towards the cost of the rent. There are some that pay more. We try and avoid having those folks stay in those units, but we have people as much as paying 60% of their income. And, you know, rents are not going down. So housing grants are going up. Next slide. No, the one with the, which one? The one with the bars. That's it, yeah. So this basically shows the distribution of the households by eligibility criteria. The blue are 65 plus, the orange are households with people with disabilities, and the gray are working families. And in addition to the folks currently receiving housing grants, it's important to note that the staff process a lot of applications. And we have, on average here, I guess this year, 1,663 applications that were processed. So that's a whole other workload that goes on. Let me see, next slide. Okay. What is the future of housing grants? That is the question. Because there's infinite need, and the cost is high, and it will continue to grow, especially as we have, you know, compounding growth, basically. I'm happy to report that the Housing Grants Program, one, did an in-depth program review in 2023, and second, received the first ever county board audit, which wrapped up in December 2024 by Wayne Scott. And we received the audit in December. We are working on addressing some of the findings. It was an excellent experience to work with Mr. Scott. very collaborative. The housing grants program, he noted correctly, needs a fully updated scope of standard operating procedures and manual. We need to do that. We need to better align our outcome measures with the Affordable Housing Master Plan. There's a number of different items on there that we are going to be working on. But there's also the issue of, shall we continue to keep spending this amount of money? We did add, remember last year, the foster care and transition age youth category that was out of the. We've had 9 applications that it began July 1st. Actually, 2 of those 9 ended up qualifying under the working families because they had kids. So they didn't need the special category. And then we have another 3 transition age youth who came out of our centralized homeless access system who are now on the program. But it has not been a significant sort of demand and push like we had envisioned. If we want to do anything different with this program in the future, we have some options for implementing a wait list, which would preserve sort of the budget at the FY26 levels. And then we would use that housing navigator position to sort of help us manage the wait list. We have experience in managing wait lists from the Housing Choice Voucher Program. So it's not unknown to us. And that's basically a policy decision that you all will have to analyze and get back to us. Right? Okay, next slide. In eviction prevention. Eviction prevention is also another area where you could spend as much money as you ever wanted to, and it would never be enough. And prior to the pandemic, it was a small program. Maybe had $1 million. You can see that when the pandemic hit, and we were very concerned about people losing their jobs and becoming unhoused, we loosened up the criteria significantly, allowing people up to 80% to come on, get served, more than several months of rent, and we spent a lot of money. $4 million in 2021, $3 million in 2022. Then the eviction moratorium ended in 2021, and the state funding ended in 2023, and the state had committed to pay for certain rents, but they didn't have any more money left. So that's what happened in 2023. We made good on the promises that the state had made. Over the past few years, we've made a few adjustments to try and bring this back to sort of a reasonable sized program. No other jurisdiction has this kind of level of funding. So we currently are expected to spend close to $4 million again in 2025. But we have put in place that the maximum income threshold is 50%. Households need to have proof of eviction pending. Maximum allocated per year per household is $3,000. And what we'd like to do this coming year is to only provide eviction to prevention to people who are in their leases for 6 months or more. It was a surprising revelation to us. We did a data analysis. 44% of the eviction prevention recipients had not even been in their lease 6 months. What does that say? People are going into unsustainable leases. And that is basically setting up people for failure because they don't have the incomes to pay for the rent on the long term. And we believe, that there is probably less oversight than we would ideally like when landlords lease up units in terms of looking at the financial stability of these households. So people are coming in, they can't afford, but, we have eviction prevention, so we can pay for it. We'd like this to sort of be taken under consideration because it is a significant amount of money, and if we did put that into practice, we would save about $1.1 million in FY '26. So that is something for your consideration. It is recommended by the county manager. Next slide. Okay. Trying to go fast. Housing choice voucher. You all know about housing choice voucher, 100% federally funded, 26.8 million projected, with an average voucher of 1,303, 1,714 households, 88% of housing choice voucher participants reside in CAFs. Similar number with housing grants, I think it's higher. We did bring in 141 project-based vouchers this year, finally, for Culpeper Gardens. So that gives us more administrative monies. And the administrative monies are then used to support additional staff if needed, or any kind of other, inspection resources, so that we can be on top of the program. Next slide. Permanent supportive housing. Another important program, which is evidence-based, provides affordable housing to low-income residents who are permanently disabled. That could be physical or mental. We have a combination of local, state, and HUD funding. We used to basically have only local funding, and then DBHDS, the Department of Behavioral Health, started funding permanent supportive housing and staff. And so now we have 3.56 million from local and 1.7 from state and 100K from HUD. And we're going to have about 351 units in FY '26. Next slide. Homelessness. Okay, I'm going to show you a point in time, but first I wanted to show you this. Because we think, oh, point in time, that's the number of homeless folks that we have in Arlington. No, it's a one-night snapshot in late January. We actually serve close to, in FY 2024, 887 individuals through this variety of programs. Single shelter, family shelter, rapid rehousing, permanent supportive housing, and we also house people in motels because our family home closed down. We served 47 families in hotels. It's a lot of money. You can see there, almost $1 million. We have now in the new RFP and the proposals that are being presented and awarded, money for that kind of lodging in those in that RFP. So, next slide. And here's the point in time, and may I say that I'm very grateful to the county board members who have joined the point in time homeless count. On a very cold night in January, I got to go with Susan under bridges and in the metros, and Takas was there, and we've had people before, Matt. We don't have the current 2025 data because it takes a while to process, but this is the 2024 point in time. What does it show? Increase, okay? Increase in numbers of homelessness, overall from previous year, 14%. And also increases, especially in veteran and chronic homelessness. Where we want to also bring your attention, and this is the next slide, we talked about seniors and the precariousness of living alone and by yourself and with insufficient income in Arlington or anywhere. So you see that our senior, and this goes from 55 plus, no offense to anybody who doesn't think they're a senior at 55, but from 2019 to 2024, we went from 261 to 339. We do not currently have sufficient shelter services for seniors. Seniors can't just be plopped in with an average adult who is in the shelter. They have medical needs, they have specific, food needs, care. So we've been working with the county manager and the Department of Environmental Services to see if there's a future option to put aside some space to have a senior-only shelter, or it's really like a transitional housing where you basically, people are discharged from the hospital, you can't go home, where do you go and get care until you're ready to go either back home or to a nursing home if it gets worse? We need something like that, so that's what we're talking about. And I think that's it.
Well, thanks, Anita. I know you've been on the spot for 2 hours now, so I'll see if I can take a few minutes of attention off of you.
Okay.
So good afternoon, everyone. I'm Ann Venezia. I'm Arlington County's Housing Director in CPHD. As Anita shared earlier, Committed Affordable Units, or CAFs, as we like to call them, provide an important supply of rental homes for DHS clients and other Arlingtonians. The primary goal of the county's Affordable Housing Investment Fund program is to create and preserve CAFs for low-income families in Arlington, including DHS clients. And the county is a mission-driven lender, and AHIF is the county's main vehicle to both preserve and create long-term affordable housing by making low-interest loans to developers. With Arlington's AHIF program, the county historically has decided to use these funds as cash flow loans, meaning the county is repaid as property funds are available. Since AHIF's inception in 1988, the county board has allocated approximately $600 million for 125 loans. And the most significant of these was, of course, the $150 million loan to help preserve the Barcroft Apartments community in 2021. And with this loan model, the county has received approximately $160 million in loan repayments, and approximately 42% of the county's loans have paid in full. For fiscal year 2026, the county manager's proposal is twofold. First is $14.4 million for the AHIF program, which includes $9.7 million in ongoing funds, $2 million in one-time funds, $2 million in Columbia Pike TIF funds, and $700,000 in federal home funds. Additionally, the county manager proposes $5 million to further pay down the county line of credit, which was used to support the 2021 acquisition loan for Barcroft Apartments, which would bring the total proposed sources to $19.4 million in ongoing and one-time funds for fiscal year 26. Next slide. The majority of CAFs in our inventory are the result of county financing, and the remainder are the result of site plan and other tools. While the majority of the county's CAFs are affordable in the 30 to 60% of area median income range, we also do have some CAFs affordable at 80% of AMI. With the AHIF model, the county's CAF portfolio grew more than 30% between fiscal year 20 and fiscal year 24, from nearly 8,700 CAFs to over 11,000 CAFs. So we've had a lot of growth in the last 5 years since the pandemic started. During this same period, the number of CAFs affordable to households earning less than 30% of the area median income tripled. Between fiscal year 10 and fiscal year 24, the county supported an average of 373 committed affordable units annually as a direct result of county financing. Because of the board's commitment to AHIF, 12% of the county's rental stock is now affordable to households earning less than 60% of the area median income, providing safe and stable housing for almost 12,000 low and moderate income families. The $14.4 million proposed for fiscal year 26 for the AHIP program may be used to further support CAF production on new or existing projects. Next slide. I wanted to take a moment to refresh our collective knowledge on how the AHIP loan model works. It's a lot of money going to this program, so I thought, let's take a moment. Again, we'll give Anita another pause, but take a moment just to talk through how the model works. So as I shared a few minutes ago, a key way that we achieve our supply and sustainability goals is through this loan model, and with the county's Affordable Housing Investment Fund, or AHIF, as the primary source. So because Arlington doesn't own and operate housing itself, we provide low-interest loans to affordable housing providers so they can create and preserve affordable homes on our behalf. These partnerships with a variety of housing organizations are key to meeting our affordable housing goals. So this is a visual depiction of how our loan fund works and shows 5 key funding sources: local tax dollars, federal home and CDBG, loan repayments, developer contributions, and the Columbia Pike TIF. With the exception of some federal funds, all of these comprise our AHIF, but we sometimes refer to this more generally as our county loan fund to help capture that federal piece. Since 2010, the majority of our budget has actually come from loan repayments and developer contributions. So for example, during that time period between 2010 and 2024, loan repayments comprised about 30% of our annual budget, and developer contributions comprised about 24%. Now, I will say in more recent years that is shifting a little bit just because our loan repayments have started to dip down because of economy, interest rates, those types of things. Our loans are getting bigger. But still, historically, over the course of time, developer contributions and loan repayments really did comprise the majority of our annual budget. So now shifting to the right side of the chart, these funds are then provided to projects as follows. So first, the county board considers loan allocation requests and provides those loan funds to developers. We then disperse those funds. Developers use those funds to acquire, build, and/or rehab affordable homes. Those affordable homes then come online. And then as the developer is able to repay those funds then go back into the overall sourcing in the form of loan repayments, which again is a key source for the overall loan fund and helps restart the cycle. So next slide. So the county's loan funds leverage outside funding to complete the affordable housing financing package. So we are by no means the only source going into these projects. So just to give you some examples here, so between 2020 and 2024, so about the last 5 years or so, every dollar of county loan funds, so all those sources you saw on the previous slide, leveraged an average of $4.70 of outside funds. If you drill down so that we look just at that local general fund tax dollar piece, which again was that top box on that previous slide, those leveraged an average of $14 of all other non-general fund sources. So we really do like to consider this fund as being very robust in bringing and drawing a lot of other capital and debt to these projects. What's also important to note is that 80% or more of these resources for affordable housing projects typically are controlled by the market and/or other agencies, and they don't flow directly through the county or even directly to the developer. They really go directly to the projects. Next slide. So with this loan framework in mind, this slide summarizes all of the funding pieces associated with AHIF and our development projects for the board's consideration. So as I shared a moment ago, the county board's annual appropriation to AHIF is one piece of the county's affordable housing loan fund. So as you saw on the earlier slide, this chart shows how developer contributions, loan repayments, federal funds, and the Columbia Pike TIF revenue also support the county's loan fund for multifamily rental development. With all of these sources in fiscal year 26, the projected county budget is $25.3 million. This slide also shows anticipated debt service payments for both Barcroft and Buckingham Villages 3, which are $7.1 million and $2 million respectively for fiscal year 26. If we add in the proposed principal payment to the county's line of credit for the Barcroft loan, that total increases to $14.1 million. So in light of the debt payments, the proposed net resources for the AF program would be approximately $11.2 million for fiscal year 26. These funds, along with anticipated carryover balances, will continue to support the county's multi-year pipeline projects, as well as potential preservation needs in the CAF portfolio. So that concludes our presentation. I think we're ready to answer questions, unless you'd like another minute.
Thank you, Ms. Venetia, and thank you for the intensive work on both. I mean, these are really tough places to work with and affect the lives of many people. Colleagues, we have commissions. I believe that to have the Housing Commission and the Tenant Landlord Commission here, right? Yes? Housing Commission first?
And I say that also because we have to publicly say happy birthday, Mr. Macbeth. Thank you for spending the time with us.
Can't imagine a better place to be on my birthday.
Happy
Thank you.
birthday.
That is dedication.
On behalf of the Housing Commission, I would like to thank the board for inviting us to be here, as well as staff from DHS and CPHD. And I believe there's also a presentation from the Office of Human Rights coming up. So the Housing Commission, sort of echoing what we just heard about, AHIF recommends that the board increase funding to $21 million for this year. So that would be increasing the total funds available for new pipeline projects, not just looking at the total $25 million that includes the debt service and other things. We're also recommending that the board provide additional funding to the Office of Human Rights to expand enforcement and outreach for fair housing violations, especially based on sexual orientation and gender identity. The Trump administration has stopped enforcing federal fair housing cases based on sexual orientation and gender identity, which means that Arlington residents will only have these protections enforced by Virginia or Arlington County. Additionally, the Trump administration has announced plans to reduce fair housing staff within HUD by almost 80%, which means that all federal fair housing investigations may become extremely backed up and just may not happen. With capacity issues for all fair housing cases within the Virginia Attorney General's office, they have one attorney for all civil rights cases in the state. Arlington may be the only option for fair housing complaints under the many protected classes. To ensure that Arlington residents and workers have their rights protected, we recommend conducting a marketing campaign to residential property owners, landlords, and residents to, 1, reinforce Arlington's key role in protecting residents from housing discrimination, 2, that residents who face discrimination understand their rights and how to seek redress. Many residents do not know that their rights are protected within the county and may think that they have no enforcement mechanism available given the Trump administration's plans to stop or limit enforcement. Also, we recommend that you ensure that the Office of Human Rights has the necessary staff to conduct fair housing enforcement and begin doing outreach to the community on their rights and responsibilities. We also recommend that you provide adequate funding for the implementation of the county's strategic plan to functionally end homelessness by 2026. The plan's goals are currently not achievable at the funding levels that have been proposed, which we find not ideal. So needed funding would include more short-term rental subsidies, like flexible rapid rehousing, that also create pathways for undocumented residents to stable housing, more supportive services, resources to attract and retain case managers to do the work, more behavioral health resources and permanent supportive housing, as well as a continued portfolio of housing for all subsidized households on the low-income stream. We also recommend, aligned with our resolution to the County Board in November 2024, that the board fund a study of rent stabilization in Arlington. And we also recommend, I think this came up in a previous session, to not eliminate the principal planner position on the comprehensive planning team to ensure that long-term planning is not negatively impacted by short-term budget constraints. And this has been talked about, quite a bit, but ensure adequate funding for eviction prevention as needs arise in excess of the proposed $2.1 million in funding, and that could come from the Manager's Stabilization Fund. Thank you.
Thank you, Mr. Macbeth. Do we have our tenant landlord? Yes.
Thank you.
Thank
Good
you.
afternoon. My name is Andrew Ferreira. I'm the Vice Chair of the Landlord Commission, and thank you, Your Honors, for this opportunity to address you all. My remarks will be brief since we have not formally convened to discuss the budget. That will be done tomorrow during our annual convocation of our commission tomorrow evening. So at this time, I will withhold comment until the meeting on March 20th. Thank you all.
Awesome. Thank you.
Yes.
That was brief. So I hear also from our clerk that our SITSAC, Mr. Denning, is here. Or online.
She is virtual. Yes.
He is virtual. Yeah, let's go with Mr. Denning.
Okay, no, thank you. Yes, I'm very virtual. I'm calling in from Austin, Texas. So thank you for the flexibility. So the Community Development Citizens Advisory Committee, CIDSAC, is pleased to be a part of the annual budget process. We support this process by reviewing programs and making recommendations for awarding funding through the county's Community Development Fund. The committee reviewed, scored, and
Tim, I think your camera is off. If you don't mind turning it on. Oh, he's calling in. I'm sorry.
He's calling from a phone,
Oh,
I
I
believe.
apologize. Sorry.
yeah. I'm sorry. Do you need me to turn the camera on?
That's fine.
Mr. Denning, we can hear you just fine.
Okay.
Please proceed.
Okay, thanks. The committee reviewed, scored, and ranked 43 applications for FY 2026 funding. The funding request totaled almost $1.8 million. We worked with staff to formulate the Community Development Fund budget recommendations. We reviewed the FY 2026 action plan and recommendation to fund 33 of the evaluated programs at our March 3rd meeting. Through the Community Development Fund and in partnership with county staff, CIDSAC works to ensure that many of the county's underserved low and moderate income residents have access to programs that help them with secure and maintain housing, avoid homelessness, achieve economic mobility, and foster neighborhood sustainability. So thank you for supporting this work. Each of the committee members brings their experience as county residents and representatives for the low and moderate income residents of their communities, and we review applications with an eye towards diversity and equity. This year, grant minimums were increased and CIDSAC recommended a smaller number of programs to fund. This involved some tough choices, like not recommending some programs that have received funding in the past. The need for competitive grant awards informed by citizen input, like the Community Development Fund, is increasingly evident. These programs ensure projects that best meet the needs of the community, and organizations that have the capacity to be good stewards in funding receive the limited dollars that are available. A challenge moving forward will be to maintain coordination with newer grant programs like the Race to Rebuilding Trust and Community and others to ensure that limited county funding is directed effectively to achieve the most impact. Additionally, guidance from the board about the goals and priorities of various grant programs and sources of funding and how we can work together to achieve the most impact would be welcomed. Finally, one last note, that CIDSAC hosts an annual community development bus tour to visit the highlight programs funded through the Community Development Fund. And I'd like to personally invite all county leadership to participate in this year's event, which will be held on April 2nd. So please do join us. Thank you. Those are my comments. Over.
Thank you, Mr. Denning. We have heard colleagues here also about fair housing issues. We have a presentation, short presentation by Gurjit Shima, who is our the Office of Human Rights. I would say we hear this presentation as well, and then we can have a conversation about the entirety of the issues. I know that the Office of Human Rights is not only about fair housing, but it's very often about fair housing. So, Ms. Shima, you're online, right? Yes.
Yes, I am.
Thank you. So you may proceed.
Okay, great. Thank you so much for the invitation to speak with you today. I'm also joined by our head of investigations, Anna Maynard, who's on the line here as well. We just wanted to give you a little brief overview of the office. We're in the county manager's department. We are on the 5th floor in suite 500. Our primary purpose is basically EO compliance and enforcement. And that manifests in about 3 different ways: investigations, education, outreach, and training. So we have an external function and an internal function. Our external function is established by the Human Rights Ordinance, with which you're all very familiar. And essentially, under the ordinance, we do investigations. We receive complaints and investigate complaints of discrimination in various areas. Those areas include employment, housing, public accommodation, commercial real estate, and credit. The most common complaints we receive are really in the areas of employment, housing, and public accommodation under the ordinance. Internally, we investigate in basically complaints under our EEO policy and our admin reg that allege discrimination from county employees and applicants. And we also facilitate accommodations, religious and medical, under the ADA. We provide training and education. So we have a partnership with the EEOC. We're a Fair Employment Practices Agency, or a FEPA. We have a work share agreement with the EEOC, whereby we do annual joint training. Last year, we did something virtual for the community. So we really, I think it was on the Pregnancy Workers Fairness Act. We try to do timely updates to the community on those types of issues. And internally, we do our EEO training for all employees, and we are really excited to be working with a new vendor on doing EEO refresher training for our managers, which we're creating right now. But we also do very targeted training for departments on internal, any trends we might see or issues we're seeing, or basically requests from department heads that we come in and do training on a specific topic, which we found to be very well received. We also try to provide EEO perspectives on any racial equity trainings that might be going on, or kind of mini trainings on the overlap between DEI, EEO, and racial equity. And then we support 3 commissions: the Human Rights Commission and its EEO-AC Advisory Committee, the Commission on the Status of Women, and the Disability Advisory Commission. I'm a liaison to the Human Rights Commission, along with Anna Maynard, as well as their advisory committee. And Courtney Sales, who is our Disability Resource Coordinator, is the liaison to the Commission on the Status of Women and the Disability Advisory Commission. So all in all, to say that this slide probably doesn't capture the extent of how much we do, given the size of our office, but it's not just about compliance, which is one thing I did want to stress. We know it's a tough labor market, and it's hard and challenging to recruit and retain the best talent. And so we really try to assist the entire county and HR and other departments to create a culture where folks know where to go if they have any issues, whether that's in the community or in the workforce, and where they can rely and trust that, a neutral party will look into their complaints and try to resolve them. Next slide, please. So you can see we have a slight increase in our budget this year. That's basically for increases in salary or, personnel expenses. One of the things we wanted to highlight is we do have 2 vacancies. So we have a total of 5 FTEs. That includes myself, Anna Maynard, Courtney Sales, and 2 vacancies for human rights investigators. Those vacancies, I think, have been in place since, I want to say, a little under a year. And we've tried to recruit. We're going out the 3rd or 4th time now. So we've been very, very diligently trying to recruit folks for them. It's just been a challenge. And I think part of that is, one, we have very high standards of what we want in these roles because of the way we write our decisions. And just, we're proud of the product we put out. So it's tough getting the quality folks. It's been tough in the past. We're hoping that might change in the future. And then 2 is, there have been issues in the past with salaries. A lot of folks can get paid for similar positions in the federal sector. We know that may be changing now because we're seeing more federal applicants coming through. We're very excited to share that we're actually doing our first slate of interviews for this last time we went out for the vacancies tomorrow and Wednesday. So keep your fingers crossed. Hopefully we've got some great applicants coming through. And we're the part of those positions, in addition to doing the investigations in the areas that I mentioned before, they will also be focused on continuing our EEO training for all employees. We really, we reset about 2 years ago with all employees having to take EEO training. We thought it was really important to get just a basic level set so we knew where everyone was at. And then this last December, we rolled it out again for all employees. I think we have almost half of employees have taken the EEO training. And now we're getting started, like I said, on our EEO manager training. In addition, we're looking to continue our fair housing testing from the County Manager's Contingent Fund. And if you go to the next slide, I can share a little bit more about our housing study. So to provide some context, previously did housing survey testing every 2 years. And the last time we did it was 2019. That was with a different vendor. Once that contract ended, we decided that we really wanted to go out and let people compete for this contract just to see what else was out there. And we were happy that we got Equal Rights Center, as I'm sure you're all familiar with them. They've come in and they're going to be doing this current survey that we're going to be putting out, the report. And we're hoping to collaborate with them in the future to do more testing and training. But the reason for the gap between 2019 and this year was the pandemic and also just the RFP process, because I think we started last year, and then by the time we had a vendor in place, we couldn't do it in time for complete it in time for last year. In terms of testing, this year's report will show that we did 65 tests through ERC. 56 unique properties were tested by 48 different housing providers. We expanded the basis of discrimination. So in the past, we typically did tests on race and national origin because we were told by the old vendor that that was the best practice. Even when we sort of tried to find out, if we could do disability testing or other bases. Fortunately, ERC actually shared that that's not the best practice, and we could do other bases. So in this report, you're going to see testing on source of income, disability, familial status, which is essentially anyone under the age of 18. There's a more specific definition, but for all intents and purposes, we're thinking of families being discriminated against. And the last one is escaping me right now. Totally escaped me. Sorry, they were for national origin. There we go. I knew I had it. So we've got 4 bases this time compared to 1 or 2 in the past. And the next steps, we're really trying to finalize the report soon. We know there's a lot of interest in it, and we're really excited to share it. And then we're hoping to planning to shift to a biannual testing where we do some testing and training every year. One of the things that we've done is work with other departments to identify all the training we're doing and the outreach we're doing in this area, and to identify where there may be gaps between what the ERC has recommended and what we're doing. And for example, one gap is maybe doing more training for larger landlords. So that's something we're looking to perhaps collaborate with the ERC on. I think that's the last slide. This was short and sweet out of respect for your time, so I'm happy to answer any questions or elaborate on anything you might have questions on.
Thank you, Mshima. Colleagues, we have about 20 minutes allotted for questions. I would take Mr. Spain first.
I'll just start where we just ended. This is for our human rights, our Office of Human Rights. Just a quick clarifying question. On it is slide 4. Where we talk about concern regarding source of income and disability, could you elaborate, expand a little bit more on what you're talking about there in that sub-bullet? Some of the fair housing.
So
go ahead.
Sure. So basically, the results that came in from the testing we did from ERC indicated that of all the bases tested that I mentioned, there were some concerns around source of income, where some property owners or managers were saying that they didn't accept vouchers. So that was one of the areas they, I think, recommended more training on.
Okay. And the last question for this particular one, I see you have your next steps and response. When should we expect that final report?
I think we're in the process of being very close to finalization, so I would imagine in the next couple of weeks that we should have it to you, if not sooner.
Before April 1st, you would assume?
I would think so, yes.
Okay, thanks. I'm sorry, Mark.
Thank you, Mr. Spain, Mr. DeFerenti, then Ms. Coffey.
Thank you, Mr. Chair. I guess I want to start similarly to Mr. Spain. The 2 vacancies, just because you mentioned them, all of the team collaborates on all of the work. So we got some questions from Mr. Macbeth on fair housing. And so if we filled the 2 positions, would that enable us to do more of the different buckets of work, the 3 commissions and all of the work? Or can you say a little bit about the two vacancies and what their roles might be, particularly given that there will be federal interest, I would imagine, in those two positions? Former
Certainly.
federal, yeah.
So the two positions are actually human rights investigator positions. So they would be focused solely on, we have three buckets of investigations. Our internal, as I mentioned, under our policies, our external under the ordinance that where residents and workers and visitors to Arlington can file. And then our EEOC work share agreement. We have that bucket of investigations. The EEO and HR human rights investigators that we would hire would be doing that work. And then not everyone does investigations. So for example, Courtney Sales, who is our disability resources coordinator, she does not do investigations. She only handles accommodations, advising on ADA and, religious and medical accommodations. I'm not sure if that answers your question, but in terms of the workload, or did you have another question on?
So the existing employees do the fair housing. The new two employees, would they do any of the fair housing work?
No, because we don't currently have a relation. We don't have that kind of a partnership with HUD. I mean, they would do housing. I'm sorry, let me go back. They would do housing investigations in terms of under the ordinance. Yes. So currently, if we get a discrimination complaint under our ordinance alleging discrimination, where it falls within that, yes, they would do it. But in terms of if you're asking about what's come up before a HUD partnership, that would have to be in place before we could do any of those investigations.
Got it. Okay, thank you. Apologies if you covered that, and colleagues, I'll try to be time efficient. I'm mindful that if we got human rights questions, I would yield to someone else. I do have eviction questions if we don't.
I'll yield, but I do have for human rights, if we're going to stay there.
We
But I'll wait.
we can complete the human rights. I don't know if it's Coffee, if she had something relevant to this.
My question was nearly identical to Mr. DeFranti's around the ability for the two investigators to provide some additional support. I think, balancing the office between EEO work and investigative responsiveness to external complaints. I think making sure that the office is doing both is important to me. And if it's a capacity issue or a resource issue, I think, we should have that conversation. But I'm hopeful you have some really great applicants who can find a nice landing spot in the county government in this applicant pool.
Thank you. Mr. Spain.
Yeah, I agree with my colleague, Ms. Colleague. There's plenty of applicants out there having served as a former investigator. I just want to ask, as we think about these two positions, just so I can be clear, how long have these positions been vacant? Again, these two investigator positions.
Right. So if I'm recalling correctly, since last May.
Okay. So May of 2024.
Mm-hmm. And we've gone out since then, I think 3 times. This might be our 4th time going out recruiting and interviewing.
And you've not been able to find any qualified applicants in almost a year?
Oh, we found a couple, but they took other positions for higher salaries.
Thank you.
I'm off of this one.
Ms.
Yes, I have a human rights question. Can you share a little bit about today, what the mix of time in the office is spent on internal versus external and on EEO versus fair housing?
It's all EEO in terms of our ordinance and internal. I think it's probably, I would say, split in terms of right now we have one person doing all investigations. And just so I can be, candid, even with the filled 2 positions, we'd be getting up to basically, hopefully keeping up with where we are at. Ideally, we would be great if we had another investigator position that could do more of that work. Just because the workload has increased, not just in investigations and not just in accommodations, but the work areas have also increased. I'd say that it's evenly split, but in terms of ordinance investigations, they take longer. We have longer under the ordinance to do them. We get a year to do them, and then we can ask the Human Rights Commission for a 1-year extension, which we like to avoid. But sometimes just the communication between parties takes that long because when the ordinance investigations, we have to wait for the other side to send us information back, right? So that can take a while. But I think they'd be pretty much evenly split. And if it's housing discrimination that's alleged, then that falls within the EEO area for us. So I would say it's evenly split with the internal and the external. Does that answer your question?
Yeah, so then maybe just to reframe the question, how much of your team's time today is spent on fair housing, and how would you anticipate that changing over the next couple of years?
It's hard to say how it I can't anticipate how it would change unless we had more resources for it. I mean, right now, any kind of housing discrimination complaints, I think we talked about this a little while ago, we don't get that many housing discrimination complaints. So I want to say, I think the information we provided last time was around 20 over a few years that were housing, mostly, like I said, their employment discrimination. So of all the ones that we're investigating, if a handful are housing, that's not too much time spent on the housing discrimination complaints. So if that trend were to continue, then we would spend the same amount of time on the housing complaints. Gotcha. If they increased for any reason, like say suddenly we have an influx of SOI discrimination allegations, well, then we would be spending more time there.
And so it sounds like our work right now is very complaint-based, but we've just restarted the fair housing testing. Will that testing result in activity by the office, is what I'm trying to get at.
So if you mean like a proactive enforcement activity, I don't think we're authorized to do that under our ordinance. The ordinance sets us up sort of as a body that the commission really accepts it through us, accepts complaints. So it's more of when we get a complaint, if it's something that falls within our purview, we accept it, we investigate it, we try to resolve and conciliate it. It's not so much sort of like an independent enforcement mechanism, if you will, that would kind of go out on its own to, seek out violations where they might be happening and then do something about them. Does that help?
That helps in terms of the investigator's time. Is there an education piece? I think there's a footnote here that says following the testing, there may be some education campaigns. We heard from the Housing Commission they're interested in that kind of marketing. Is that your office or is that someone else that needs to do that?
Oh, we'd absolutely be partnering with the other departments on that. And, we're actually starting to see where we've updated some things like some posters around SOI and just trying to brainstorm what we can do to push more information out with the other departments, especially around SOI.
Great, thank you.
Mm-hmm.
Thank you, Ms. Cunningham. Ms. Coffey?
Okay, back to broader housing.
Back to housing.
Okay. Thank you for still being here with us. So I have a multitude of questions, but I think on homelessness, I think we're seeing need increase. We're seeing, especially our family beds have decreased. And, I have heard from community partners that especially outside of the hypothermia shelter months, that there just is not anywhere for people to go. To me, I think it is indicating we need to find a pathway to create more total beds. Have we put any planning or thought into what that would take or how we would get there? I know the goal is always rapid rehousing and permanent placement, and we would love for that to be true, but the reality is that that's going to take even longer, I think.
Is that one for me? Or is Anita?
No,
right?
but thank you.
So
this is for Anita.
yes, we need increased capacity. Shelter is not the best practice, but we know that affordable units are far and few between, and the folks who come out of living on the street takes a lot to move into a unit. I just wanted to point out that it's not an insignificant amount of money that we currently spend.
Yeah.
I tabulated it this morning, and the continuum of care, which refers to the entire continuum, we spend $7.5 million annually. 54% of that is local, and 46% is state and federally funded. However, we know that we lack sufficient shelter beds. We have been working at the approval of the county manager's office with DES on looking at expanding space for unsheltered individuals in 2020 14th Street. Is that the not right number of the building? Because we typically have been using one of the floors for overflow anyway, for hypothermia. That current shelter was only budgeted, I think, for 50 beds, if I'm remembering correctly. And so we need extra space. So we already have a design from DES for one of the floors. And I believe there is money in the CIP, right? To start working on potentially building out a space. That's on one floor. We're also looking at another floor in the same building for senior transitional housing. Michelle can come and want to talk about it, Michelle?
Yeah, no, I was just going to chime in.
Yeah.
It's included in the CIP. We've begun those conversations. It's not inexpensive. There's a fair amount of infrastructure work that still needs to happen at 2020 in terms of elevator access, HVAC, windows. So it's in the CIP in those belly years, if you will. I think the earliest we think this could get stood up, given the amount of infrastructure work, is like 27. I also would note that it requires a use permit process. So we would need your support. There's a current use permit for the current Homeless Services Center, but that will also be needed. So in addition, so it's not just capital, it's use permit, and it's also then additional operating costs to serve those functions. As you know, it's 24/7, certainly during hypothermia with the type of services we provide, so.
Yeah.
I mean, I say all that, that's just data, it's facts, but we're all in with the work plan, you know what I mean, to see what it can do. Will it solve everything?
No.
Yeah.
Right.
No, I really appreciate all of that context. I think, yeah, it's gonna take a lot of inputs to get there, but it's good to know that everyone is talking and planning and.
Yeah, and then you can have some efficiencies by having everything sort of in the same
one place
building.
Yeah, that makes a lot of sense. Great, thank you. My other question is on eviction prevention.
Sure.
Because I think, when we put most of this proposed budget together, it was before some of our local disruption had started. And I'm wondering if we, even with some of the changes to eligibility that we're putting in, one, I want to confirm that people who have a sudden disruption in income are still eligible,
Yes.
even with the restrictions.
Yes, we have, in fact, Brooke Hammond Perez is the appeals person who basically, we really try and prioritize, first of all, families with children, both in eviction prevention and in homelessness when we have people who are on the street. But there are other ways to look at this. It doesn't have to be 6 months. It could be 4 months. It could be 3 months. We have the data for that. We also had discussed perhaps not providing eviction prevention to people who received housing grants or housing choice vouchers, because we thought, well, don't they already have a means? But I think the system needs a little bit of review with the landlords, in my humble opinion. I think I've discussed this with Takas before, but I realize how expensive it is to develop these units, but we really need to figure out who is coming into the units and whether or not they can afford them, because we don't want to set up people for failure.
I do believe, though, that Ms. Coffey refers also to the extraordinary circumstances of
Yes.
maybe higher income households that may, have the rug pulled under their feet.
Yes.
And they typically are not eligible because they are paying far higher rents today. So that's an additional problem, right?
Well, with I think we have a threshold, right, of 150% of fair market rent, right, Brooke? someone who's in a unit above 150% of fair market rent will not qualify for eviction prevention. We're not subsidizing people who are in overpriced.
Right, and that actually wasn't my question.
Yeah.
It was more about, we're proposing some additional restrictions
Right.
on eligibility for people in
Yes.
the early half of their lease. But
Right.
if you sign that lease thinking you were going to be making,
Yeah.
$90K a year and now you've lost your job.
Exactly.
Those people will still be eligible
still
even
eligible,
in the
yes.
first 6 months, right?
Yes, for life, extenuating circumstances that are beyond one's control. And we're also looking at their ability to pay moving forward. Sometimes people are in a transition between one position and another, but if they can demonstrate that they just need to be held over for a little while so they can, until the next job comes in, we always make accommodations for that.
Great, thank you. And then kind of in addition to that, I guess, the question of whether we think the increased need from the federal firing situation warrants potentially some additional dollars towards this, that even with the, eligibility criteria we're proposing here, that the need might just go up faster than what we've predicted or allocated before now. And I think, that's
I don't know if we have data yet on how the loss of employment on the federal level is impacting people's ability to pay. We can do whatever the board directs us to do. I mean, I remember back after the housing crisis in 2008, we had an infusion of funding there actually to pay for people's mortgages. It's not something that we like to do, but in severe circumstances, if we see that a certain number of people in our community are in this predicament and we don't want them to be unhoused, there are many alternatives that usually require money and staff, and so we don't have that. We don't have data on that yet.
Thank you.
Thank you. You probably have to identify other sources of funding for all this.
Yeah,
And,
exactly.
And also, hardship-centered versus an eligibility-centered system. So,
Correct.
Mr. DeFerranti.
Thank you, Mr. Chair. Kind of tracking a little bit Ms. Coffey's buckets first to the manager and to your staff. Thank you so much for the additional investment ongoing of over $2.5 million, I don't know the exact dollar amount, in homelessness. I will risk upsetting staff in the room and perhaps previous colleagues. We have a great history on affordable housing. I am still learning the history we have of deep commitment to homeless prevention. And perhaps that's because maybe we haven't had the scale that other communities nearby without, this is super important to all of us on the board, and it's really important, and so I'm very grateful. We have to invest in our providers in work that 50 years ago local governments didn't do and Arlington didn't do, and that was wrong, and we need to change that. So really grateful there. I will ask, to Ms. Coffey's point, I am open, but I like when we write budget guidance to actually have something to say instead of just precatory word salad or whatever. But I'd like to see if I can work a little bit with Ms. Cowan to see, because there's two buckets, right? There's the two places at 14th Street, and then there's the question of, do we have, keeping in mind, emergency shelter is not where we want to go. We want permanent housing. Do we have demand that we think is going to be sustained such that additional capacity, not tomorrow, but over time? So that's a question for guidance, and I'd welcome Ms. Coffey or anyone if you want to work with me a little bit on guidance. I'll be happy to draft if there's a there, and then you can revise. I'd also ask, just to lift up, grateful for Ms. Cunningham, the work we promised to do, and I have not done yet, on a meeting just with Ms. Cowan to kind of understand a little bit the homeless world. And so I'll send an email that can set that up without belaboring it. But I do think it's important to have that conversation in the next 2 to 3 weeks. Eviction prevention, I went to the continuum of care. I was not chaperoned by a deputy county manager. I hope that's okay. But I went this past month and tried to explain the eviction prevention change that we're making. This is preventing dislocation. And so I am aligned with the choice, the tectonics that we referred to of the challenge of federal employees, like how many have mortgages. I heard, I got shared from a colleague of a couple that both feds, and they got denied from their mortgage application because they were feds. That ain't the right world, for sure. But because their jobs were uncertain. But I would just say that our feds are committed to public service, and many will understand the tension of trying to meet their immediate needs. And if you've had a mortgage that you paid 20 years, you are in a different circumstance, I would submit respectfully, than someone who is at risk of becoming unable to pay their rent and thus homeless. Because there are feds, if you go to HUD, you will see that there's different federal employees, and it's challenging. So I would just say, specifically to Ms. Hamman-Perez and to Ms. Friedman, can we find the slide that shows we do more on eviction prevention than almost anyone else in the region? Just the data, and then share it eventually with the board. Because our community was saying, why would you ever cut eviction prevention? But it is true that if someone can never pay, or if we are attracting someone to a position, then we shouldn't, to a rent that they cannot afford, and we know that will happen in 9 months or 12 months, I'm aligned with the proposal from the manager. So, and then last, on housing grants, any cuts to that, you're going to have to come through real estate tax relief, because I'm not interested in that. You're going to have to come through and tell me that we should be subsidizing more than $250,000 in assets when $30,000 is the housing grant piece. And then I think there's something that Ms. Hogan, who I think is still in the audience, we haven't articulated that is important to articulate. And to Mr. Macbeth's point, we should do AHIF. We want to do AHIF. The history is that all one time goes to AHIF. We're putting $11.5 million in the economic stabilization because we want to do more affordable housing. We're still losing some market rate affordable, but we have to stabilize. And thus, I believe at this stage, to wait on AHIF is, with the 19 million that you described, Ms. Venezia, is a reasonable choice. And I hope that's not too long, but I do think eventually someone had to say that in the course of the budget, because that is a big structural change in how we're doing the budget this year, because I think we're all worried about stabilizing those folks who may be at risk of becoming homeless. And so, but I don't know, I hope that's not too long. Thank you, Mr. Chair, and Ms. Friedman, if you got stuff, that's great.
Can I respond directly to the question? Thank you, Mr. Karantonis. So we do have information on other jurisdictions about eviction prevention. There is no assistance in Fairfax, Loudoun, Prince William, and the one in DC ended in November of 2024. Alexandria provides up to $6,000 annually per household for low-income residents, but they must be 65 plus or permanently and totally disabled. Ours is open to any household. Falls Church has a similar qualifications, but they are limited to $2,500 annually. So Montgomery has limited amounts for 60% AMI and below, and they must not have received any eviction prevention assistance in the past 12 months and must have received a court summons for eviction or put-out notice. So, and they require that a person lives in the county for at least 9 months before receiving eviction prevention. So, yes, ma'am.
Just also want to chime in, just as a reminder, we are the only local government in the region that provides a housing grant program. So that, remember, that's on top of eviction prevention.
Right.
So, and that program now is, what's the dollar amount?
$17 million.
So I just want to put that in perspective. And you saw, I think, the data that DHS provides, right? Working families, disabled, and seniors, and where that goes. So just to put all of that in, the investment in perspective, I think is important.
Thank you. I guess it's always one of the major discussion points is
what is the benefit, not only what is the cost. So we ask, we discuss very often, I mean, what is the value of avoiding homelessness?
Right.
What is the value of keeping, aging Arlingtonians in their homes, of not?
Right. Well, the eviction prevention, people still do get evicted. I forget, Brooke, you had that number, what percentage it was, that 25% still get evicted after eviction prevention.
Checking on the time, we're now really a little bit against the ropes. Mr. Spain, then Mr. Cunningham, and then we can wrap up this.
I'll be quick,
part of the
Mr.
session.
Chair. Anita, thank you again for being here. You know, I have a sweet spot for veterans, having served for 26 years in the Marine Corps. I am looking at your point in time survey, and this is from last year, and I can only assume that perhaps the veteran homeless numbers are going up. Can you talk a little bit about, if there's anything different we can do as far as shelters or working? I mean, I'm not counting on the Department of the VA right now, but what can we do locally to help perhaps some of our veterans and military families who may be suffering from homelessness?
Sure. Well, we have, particular set of vouchers from Housing Choice Voucher, the VASH vouchers that are.
What are they called?
They're called VASH vouchers,
VASH, okay.
Veterans Assistance Housters, VASH. And we actually didn't have those at all about 15 years ago, but we went and banged down the door of the veterans, and we now have, I don't know the exact number, Brooke can find out. I mean, we do, so we have those, but they're usually fully booked up. I mean, we can, as I said before, we can do anything we want, as long as it's legal. But the,
And we call legal.
housing
So-
grants, you could make another category for veterans.
Yeah.
Or veterans who are, unemployed. Because that may be, at this moment in time, something reasonable to do.
Yeah.
And that would open up a line of housing assistance that we don't have, if they don't qualify, let's say, as disabled or 65 plus,
Great.
so.
Thank you. Thank you, Mr. Chair.
Thank you, Mr. Spain, Ms. Cunningham.
This is our last chance, so I got to get all my residual questions in. They'll be quick. First is I want to do a huge shout out to the DHS team for having the best performance metrics. Every other section, I'm like, what are the goals? What are the targets? And you guys are the best. So thank you, and we all hope to join you shortly. We did not spend much time on the homeless contracts, which are increasing precipitously. Could you help us understand that increase, and in particular breaking out what is cost of living and sort of deferred inflationary pressure and what is actually new services?
Well, I may not be able to give you all of the information because it's still it's not a completed procurement.
Oh, got it. Okay, so that might be a follow-up question for
Therefore,
later.
Yes, I am held bound to the procurement
Perfect.
rules, and Glenda Pittman is saying, better not say anything.
You're getting applause from the peanut gallery in a number of places. Okay, we'll put that as a follow-up question when it's appropriate. Secondly, we have heard frequently from our nonprofit providers and our clients, our residents accessing services, that income verification is painful and must happen every year. How close are we to having a one-stop shop for income verification, or what would it take? Is that sort of a CIP level investment? Have we tried it and it doesn't work?
Oh, we've tried it. We have tried it. We have tried it multiple times. It once was called DOC, another time it was called ETO. We have tried to streamline our eligibility and intake process in DHS over numerous attempts with different kinds of softwares, and we have not been successful. I'm just going to say that because there are so many specific lines of business, each one with a varying criteria, and it has been very hard to unify that. I mean, I think, well, is she here? Yes, Michael Dharma Irwin, I have not given up that she will come up with a solution with Glenda in the next few years, but it would be such a blessing if we had this one way in which people could come in, give their ID, give their documents, put them up in the cloud, and then we would all be able to see. Yes, that is also the problem. Yes, Dr. Schwartz brings up a good point. We have, I don't know how many different systems, 70 different systems. 10 are legacy systems. There's another 10 or so that are state systems. So we don't control all of these systems. We have to input into them, and they do not let us pull out without permission. Like the Virginia Department of Social Services does not let you extract unless the person who comes in signs a waiver that you can access the data. So there's a lot of complications. We just never have been able to quite figure it out. But I would love to.
Great. Let's put that on our legislative agenda as well as our CIP midterm check-in, because I think there are some solutions developing. We might be able to do a pilot for the state and save everybody a lot of pain and agony. The last one is Barcroft and the AHIF fund balance. So the managers recommended a $5 million additional pay down. I think we're running at $120 million of variable interest rate debt there. Is there a reason we wouldn't go a little deeper, given that we have uncommitted AHIF funds? I'm sure people have argued this back and forth, and there are really good reasons, but is $5 million exactly the right number? Variable interest debt seems scary to me right now. The manager decides.
Sure. So, I mean, what I can do is speak to the impact that the paydowns to date have had on our annual debt service. So to date, as you said, we've paid down about 30 million of the original 150 million line of credit. And as a result, it's a little hard to tease out because, as you said, it is variable rate interest. But our annual debt service payment has gone down about $1.5 million since we started paying that debt service, which is about 10 to 15% savings with that $30 million paydown, principal paydown. So we could consider that. Again, I think that's a policy decision that the board would need to make. Certainly there are longer term impacts to consider that I think are benefited by bringing that principal down as low as possible. At some point, we'll be looking to lock in tranches of this debt so that we don't have the variable rate interest. And I think we're all aware how math works, and it's always better to lock in a lower principal amount than a higher principal amount. So.
Yeah, I would add, and
Save me, Mark.
No, you're right. We have variable rate debt that has a term, I think, through some point in 2026. So it's slightly tolerable at the moment, the rates that we're paying. We have been paying close attention. It seems almost every time we were on the precipice of going into the market to fix the rate, something happened.
Yep.
And so that is the situation we're in. I think we still have a little more time between now and sometime in calendar 26 to really wrestle this issue. We may be forced in 26, who knows what the circumstances are going to be like, to fix out a rate that might be intolerable. So I appreciate your question, and we're paying attention to it. So right now, this was the amount we thought we could do. It sort of, in the past, we've done $15 million. I would say $5 million is a good faith investment. Mm-hmm. And we would have liked to have done more, but we're just a little bit anxious about where things are.
Great, thank you.
Thank you, Ms. Cunningham. This, I believe, concludes this part of the meeting, of the work session. Thank you so much, Ms. Friedman, Ms. Venezia, for the insights, for the presentation, and for the continued work. Colleagues, we may take 3 minutes of recess until we change here and we go over to Ms. Bird and CPHD, the amazing people of CPHD. Thank you. Thank you. So we are ready to continue with our Department of Community Planning, Housing and Development, CPHD, which now comes with this amazing, now collaborative, passionate, helpful, and dedicated. I love this slide. Ms. Bird, thank you for being with us today, and everybody with CPHD who is your companion today. Thank you, everybody, for their work and for starting this conversation right now. So the floor is yours for a long presentation. I understand, but it will be a substantial one. So
I will do my best to be efficient. Good afternoon, almost evening, everyone. My name is Samia Bird, Director of the Department of Community Planning, Housing and Development, and I will be presenting on our FY26 budget proposal. Next slide, please. CPHD is a multidisciplinary team of just about 220 staff or a little under. We operate out of the Bosman Government Center here, the 1st, 7th, and 10th floors, and online and within the community. Our work and positions are spread across 3 funding sources, about which you will hear today: the General Fund, the Development Fund, and our Housing and Community Development Fund. Next slide. CPHD is organized into 6 different divisions along with the director's office, which includes our communications and engagement team led by our CPHD communications manager, Rachel Lapiana, and our research and strategic initiatives group. Think CMRI, Digital Equity Initiative, Data and Demographics, led by our assistant director, Jill Hunger. The department's director's office provides the vision, leadership, and strategy and structure under which the department carries out the mission, together with the business operations division led by Cynthia Hernan here. The business operations division facilitates the organizational and resource capacity needed for staff to conduct its work. We also have our housing division, who you heard from Ann Venecia. We also have our inspection services division led by Shariar Amiri, our chief building official, and we have several staff here from ISD as well, zoning and housing, I see. We also have, and people online too. We also have our neighborhood services division led by Chikwe Njoku. We have our planning division led by Anthony Fusarelli, and we have our zoning division led by our zoning administrator, Arlova Baum. Next slide, please. Our mission embodies the values of the county expressed in its vision statement and is fundamentally the nature of CPHD's work, connecting place and people. CPHD's leadership team has been initiating strategic planning to align our work priorities and approach more directly with this mission and the county's vision and resources. Next slide, please. CPHD is working to realize Arlington's commitment to equity across all divisions and projects. This is reflected in the highlights, accomplishments, and priorities included in the next several slides, and you'll see this interwoven throughout. A few overarching things to elevate from an organizational and operational perspective. We use the county's equity lens in our plans, programs, and processes of asking who benefits, who's burdened, who's missing, how do we know? And we have begun to advance the regional principles for equitable development adopted by the board in April of 2024. We detail a lot of this in the county board reports and presentations that come before you. We applied the equity lens to our budget proposal as well when considering requests and reductions. And we actively participate on the county's racial equity core team, and we look forward to evolving CPHD's equity team to meet the needs of the department today and in alignment with the direction of the county. We are active members of the Government Alliance for Race and Equity, serving on the steering committee and the Housing, Land, and Development Network. And lastly, based on the results of our racial equity assessment and the follow-on analysis we completed for CPHD, we will be focusing our racial equity action plan in the areas of inclusion and belonging and capacity building, among a few other things. We continue to assess our efforts as this work continues. Next slide, please. So we had a different one. It looks like a different slide, but with the graphic.
Close your eyes.
But so So in your deck, you have a graphic that represents a lot of the accomplishments and highlights for the department. A couple of them that I'll just elevate, there's 134 new CAFs approved through site plans and $365,000 in AHIF contributions. There were 5 approved site plans, 2 form-based code developments approved on Columbia Pike. We had 2 phase development site plan approvals, 10 zoning ordinance amendments, more than 100 use permits and site plan amendments, 125 BZA cases. When we consider safe and orderly development, we had 820 zoning inspections, 1,100 CAF unit inspections, 759 certificates of occupancy issued. We reviewed approximately 40,000 building and trade permit intake and issuances and completed more than 45,000 building inspections, 14,900 building permit plan reviews, and we reviewed 6,400 zoning permits. Between zoning and ISD, we responded to 1,000 FOIA requests and issued 10,360 construction permits.
Look,
Oh, I know, so
isn't that awesome?
We served more than 6,500 customers in person via the Permit Arlington Center with a 92% customer satisfaction rating. And I want to take a pause here to share a few stats about the Permit Arlington Center, which, as you know, effective July 2024, we expanded the Permit Center hours and days from 2 days a week, 6 hours per day, to 4 days per week and 6 hours a day. July 2024 through the end of February 2025, we saw 2,526 average total volume. We averaged about 20 daily persons. We had weekly average volume of about 80, our average wait time 4 minutes, and the average service duration about 13 minutes, and trending a 93% slightly higher satisfaction rating. And this compares to the time period September 2022 through June of 2024. The same metrics. Total volume was about 5841, about 31 on average daily, 63 average volume, 6-minute average wait time, and average duration in minutes was about 13. So a little better over that one time period with extended hours. Since the expanded...
Mr. Chair, I apologize. I'm hearing that there may be an issue with the audio on broadcast. Would we mind pausing for just a moment?
Okay. Can we?
It may have just been restored. I think we're all right. Sorry, pardon the interruption.
We're good. Okay. We apologize for the
problem.
The interruption. So
You just have to start over.
No. Moving forward, but not going back, not going back.
we are not going back.
Since the expanded hours have been implemented, the average weekly traffic has increased about 27%. So again, from the 63 customers per week to 80 customers per week. Our average wait time has decreased about 33% from 6 minutes to 4. The average service duration remains consistent, and our high customer satisfaction scores remain, like I mentioned before. About the map on the left, it depicts areas of neighborhood investment. So we had about 14 neighborhood mini grants, 15 new historic markers, 4 Arlington neighborhood program projects at about $1.46 million in improvements, 13 participants in our Arlington Neighborhood College Leadership Academy, which represented 10 neighborhoods, and the distribution is shown there on the map. Just a few other projects that are not there, but I wanted to reference by name: Barcroft, our home ownership study recommendations, Reeves Farmhouse, some of the zoning ordinance amendments advancing CMRI, like outdoor visual entertainment. We also had a number of others. Columbia Pike Green Building updates, updated our landscape standards. We had elder care housing affordability amendment, recovery residences, and alterations and additions to non-conforming multifamily. And then the other things, launching our digital equity initiative with the emergence of the Digital Equity Coalition, engaging with community, offering digital skills training and resources to empower residents to fully participate in our tech-driven world. And I'll talk a little bit about that later more. Next slide, please. So for CPHD, and looking at the FY26 budget priorities, it's about balance. So we've had some hard conversations about reductions, program considerations, and balancing priorities countywide with values and divisional needs in the absence of enough time really to be strategically focused. Understanding the demands and desires of the county and the community and needs of staff, how do we effectively continue to serve and engage with excellence? Many conversations have been had about the health of the development fund, the economic outlook, and federal uncertainty implicating the general fund and the housing and development fund as well. CPHD's proposal has been a challenging one with tough decisions that effectively shift us quickly to think about what prioritizing in this environment means, and that's really trade-offs. Adding a position here may mean a reduction in a position elsewhere, and for CPHD, all of our work is interwoven and connected across the department and resources as well, as you will see throughout this presentation. It means managing expectations, perhaps saying no or not now, and that everything will not and cannot get done in a single fiscal year's budget. So we're focused on life, health, safety, and continuity of good governance. Good governance is, in this environment of strained personnel and constrained and limited resources, values-based decisions to remain committed to equity, resilience, wellness, centering people, and protecting staff morale to the extent possible. So with that, I'm going to look at the three funds next. Next slide. The general fund. In FY26, the proposed approach for CPHD in contributing to addressing the budget gap includes looking at increasing revenues through planning fees to be further described in this presentation and reducing expenditures. Revenues increase as a result of significant increases proposed for planning fees to recover costs for development-related work at 100%, and expenses decrease with personnel reductions strategically focused on vacancies in the general fund. Next slide, please. I'll speak a little bit more in depth about the fees when we discuss the development fund, but with the proposed increase to planning fees related to development services, again to recover at 100%, we anticipate revenues at approximately $3.1 million with an impact to the budget of $1.45 million. A little more about the two positions proposed to be eliminated. Both positions are currently vacant, and there will be no direct impact to staff in that regard because they're not filled. But impact to the work includes, when we look at the principal planner position, this is in our comprehensive planning section, reduces overall capacity for countywide land use policy and regulatory work, will create a void in the planning division structure for coordinating overall planning and development activities in 1 to 2 specific growth corridors. It will result in greater staff burden, the suspension of scaling back of project scopes, and reduce project pace or progress, diminish resources that are attentive to key stakeholders in areas of the county that are experiencing high development activity and changes in the built environment. But I want to say that this is reflected in the planning work program that was presented to you last week, so that has been taken into account. For the code enforcement inspector, this will eliminate the ability to conduct proactive inspections, increases the response time in hoarding cases, which have significantly increased from 3 to 5 days to 5 to 8 days, and will increase the average time for compliance to 90 days from what is now 63 days. Next slide, please. The Housing and Community Development Fund. Next slide. So this fund supports several affordable housing and community development programs consistent with the goals of the county's FY 2024 through 2026 consolidated plan. The goals are 1, to create and sustain affordable housing, 2, to promote healthy and self-sufficient families, 3, to stabilize households at risk of homelessness, and 4, foster vibrant and sustainable neighborhoods. In addition to affordable housing and community development programs, a portion of Housing and Community Development Fund dollars supports administrative and planning functions in association with these programs, which includes funding 4.5 FTEs within our housing division. Funds go toward Community Development Fund grants to nonprofit organizations serving low and moderate income residents for such things as job training, youth, programs for seniors, housing development, homeownership, housing rehabilitation, certain economic development programs, and business development. This fund also provides for our MyPAT program and multifamily loan funds. Next slide. Oh, could you go back one, please? I'm sorry. So the Housing and Community Development Fund, primarily resourced with federal funds and program income, reflected in FY26 is a reduction in the overall fund amount from FY 2025 based on reduced program income, though balancing revenues and expenses for the proposed fiscal year as in FY 2025 is accomplished by decreasing non-personnel costs to offset increased personnel costs. There is no anticipated change in the number of full-time employees supported through this fund. We continue to monitor events and actions at the federal level, given uncertainty around these grant funds. Next slide. The Development Fund. And you can stay on this slide for a moment. So the Development Fund, I want to give us a little bit of background and bring us up to where we are today. Was established, as you know, in FY28 as an enterprise fund and shifted the Inspection Services Division and Zoning section, which was at the time within our Planning Division in Community Planning, Housing, and Development, whereby fees charged to the customer to recover costs for providing development services were intended to generate revenues to fully support the operating costs. Fee increases in both ISD and zoning would generate revenue dedicated to specific development services. Operations also focused on greater level of customer service. The increased and dedicated revenue was used to make further enhancements in technology, staffing, and infrastructure associated with delivering quality customer service. The nature of development and the construction building industry is subject to fluctuations, and over the last several fiscal years from FY 2018 to approaching soon FY 2026, more so. Dramatic fluctuations in development between rapid expansion with Amazon HQ2 and then the COVID-19 pandemic soon thereafter, followed by post-pandemic shifts in the office market, and interest rates, among other variables, have exacerbated development fund balances, a product of revenues and expenses primarily. Various steps to reduce expenses, including holding positions vacant and reducing other non-personnel costs, were feasible over the years, has been how we have approached the fund with an eye toward cost-saving strategies. However, the Development Fund has continued to see expenditures exceed lower revenue levels, and reserve funds were used to offset these lower revenue receipts. Also, expenses have increased over 40% with the final implementation of the new permitting system. Typical compensation costs increase, contract costs increase, and the addition of staff to meet the complexity and permitting activity of Amazon HQ2, and the demand and improvement to customer service. The purchase and implementation of the permitting system significantly impacted the fiscal stability of the fund by overutilizing the reserves for technology development. Using debt financing as opposed to cash financing would have spread the software development, implementation, and maintenance costs over a longer period and not drained reserves, which were set aside to manage varying economic environments. A technology surcharge of 10% will continue to be utilized and earmarked to support day-to-day technology costs moving forward. A fee study and analysis conducted in FY 2023 and FY 2024 showed that the overall fee structure was behind on cost recovery despite fees being adjusted over the years for normal market inflation. In FY 2025, fees were adjusted in varying percentages to increase the cost recovery of the fund as part of a planned multi-year implementation approach. As development activity has continued to be stagnant, the cost recovery of the fund has continued to erode, leaving an estimated FY 25 negative balance of $13 million. This brings us to FY 26, the proposal for the development fund that we're looking at today. Next slide. With a gap of $13 million projected for FY 25, our starting point for an approach to FY 26 was balancing revenues to equal expenses. To do this, we propose a multi-pronged approach. One, increasing fees to recover costs to 100%, with a few exceptions. Two, reducing personnel and non-personnel expenses. And three, structural realignment of some services not directly related to the development fund, but to the general fund. In FY 2024, the fund balance was negative $5.3 million, with a total of 136 employees. In FY 2025, the projected fund balance adopted was negative $13.3 million and still 136 employees. In FY 26, we show a fund balance of negative $10.4 million, an elimination of 4 positions which are filled, as well as 3 positions proposed to be frozen, and increases to both zoning, inspection services, and planning fees associated with development as part of a continuation of the multi-year strategy to increase fees. A footnote here, the planning fees for development-related services accrue to the general fund and not to the development fund. Across the 3 fiscal years from FY24 actual, FY25 projected, and FY26 proposed, you see the increase in revenue and then expense increases to a lesser degree summarized on the slide here. To take a closer look at fee proposals by the 3 different divisions. Next slide, please. As mentioned, this is the second year of a multi-year adjustment of fees to fully recover costs of ISD zoning and planning services related to development. DES fee increases were discussed in their work session on this last Tuesday, March 4th. Next slide, please. So proposed fee increases, FY26 for ISD. In the first year of the multi-year increase, FY25, ISD fees, of which there were 144 in 17 categories, increased generally between 25% and 50% of full cost recovery. It was indicated in FY25 that the fee adjustments for ISD would occur over 2 years. The exception was fees where additional analysis was needed, and there was not a proposal to change those fees in FY 2025. For FY 2026, building permit fees for new construction, additions, and alterations are proposed to increase between 70% and 79%. At the time of filing for a building permit, customers currently pay 35% of the cost. This is proposed to increase to 50% at the time of application to recover more of the upfront cost to review building plans. For trade permits, which include permits such as mechanical, electrical, plumbing, the proposed fee increase is 70%. In addition, 2 new ISD fees are being proposed. One, a fee for cross-contamination, which is to ensure that potable water is not contaminated by sewer water, and a fee for certificate of occupancy inspections. Next slide, please. For zoning fees, one change from FY 2025 in consideration of the development fund balance, fee analysis, and structure of the fund was a review of services provided by zoning, which identified that 30% of operating expenses go toward work that is not directly associated with development-related services. As a result, it is proposed that $1.7 million, the estimated cost associated with non-development related work fulfilled by zoning, would be associated with the general fund. An example of this type of work is shown on the slide here. And this is in the category of structural realignment of the development fund. Next slide, please. With 30% of operating expenses being funded by the general fund, full cost recovery for development-related fees for zoning would be 70% for FY 2026. In FY 2025, based on the fee analysis, 106 zoning fees in 5 different categories were anticipated to be adjusted over a 3-year period to full cost recovery to 100%. This is proposed to occur in FY 2026 as opposed to this year and next year, meaning a 2-year multi-year approach and not 3, particularly given the adjustment being made. As proposed, fees are being adjusted either up or down in consideration of staff time, complexity of the work, and customer impact. Exceptions to achieving full cost recovery at 70% for zoning fees includes fees that were at 15% or less in FY 2025 would increase by up to 21% in FY 2026 to better align with review costs while keeping fee increases reasonable for such things as signs, retaining walls, certificates of occupancy for townhouses, appeals, and use permits or variances for single-family homes. Fees will be adjusted by 30% where it's been determined that work associated with delivery of those services requires a higher level of staff time, such as things like modifications to commercial buildings and some commercial COs. This also would be the case where it's proposed to match fees with those where similar effort is required, so exterior additions for single-family, townhouse, and 2-family. And then there are some fees that will not recover costs due to things like low level of effort required, sensitive populations impacted like nonprofits and family daycare home, and work that is required to be completed regardless of the cost to provide the service, such as zoning appeals. In addition to these fee increases and exceptions, a new fee is proposed for electric vehicle chargers associated with special exception development, so site plans and use permits, and a fee for EHO permits is also proposed to be eliminated. Next slide, please. The planning fees. There are 94 fees in 7 categories in FY 2025. They were proposed to be adjusted over time to up to 75% cost recovery based on the premise that 25% of the work performed for some development services was outside of an applicant's control, namely public process-related things such as county board and planning commission requests and resident and community outreach and engagement. Planning fees were proposed to be adjusted up to 75% recovery by no more than 30% each year until that 75% recovery was reached. With additional review and consideration of the planning fees, level of effort, and overall customer and applicant benefit of the service provided by staff, in FY 2026, the proposed cost recovery for all planning fees associated with development is 100%. What this means is that between FY 2025 fees and the proposed FY 2026 fees, the increase could be up to, but will not exceed 200% to get to that 100% recovery. It will vary based on existing recovery levels. Additional charges over FY 2025 are also shown on this slide as more administrative and technical in nature. And again, a reminder, as shown in an earlier slide, the revenues generated with fees for planning accrue to the general fund, not the development fund. Next slide, please. Looking at the proposed changes for the development fund with fee increases, personnel and non-personnel reductions, and structural realignments. We show $1.5 million from zoning fees and $1.73 million from the general fund, and this is again that 70-30% split. $505,000 in revenue increases associated with ISD fees, plus $1.1 million in a technology surcharge to utility fees as discussed during the DES work session, and a thank you to DES. Some changes in expenses associated with the development fund include an increase of $309,000 for permit Arlington contract costs associated with ongoing system implementation, and a reduction of expenses in $205,000 associated with 2 DES positions being transferred from the development fund to the general fund, where work is not directly tied to the development-related services provided. Next slide, please. I spent a lot of time detailing proposed fee changes for FY 26 in association with the development fund, but the balanced approach to addressing the development fund deficiencies, not only structural, looking at the fees and truly aligning the costs of development-related services to the fund and full cost recovery, but also personnel and non-personnel reductions. Like the general fund, within the development fund, there are a total of 7 positions that are impacted by the FY 2026 proposal. The approach is to consider vacancies over filled positions. However, given the status of the fund, this was not avoidable. This includes 4 positions that are currently filled, 3 in zoning and 1 in inspection services. The impacts of these reductions. The zoning inspector, there will be increased complaint response times from 2 to 5 days to 5 to 10 days. Response time to certificate of occupancy, special exception use permits, and active site plans will also increase due to increased workload on remaining inspectors, and an increase in the use of overtime to complete time-sensitive requests. The zoning technician position, longer review times for sign permits reviewed by the team, though staff anticipates continuing to meet or nearly meet established review times for other permits reviewed by the team. The principal planner, increase in response times for the completion of complex zoning determinations from 36 days to 40 days. Zoning ordinance text amendments will be deferred or redirected to other staff, potentially outside of the zoning division. Overall reduction in the number of zoning ordinance text amendments completed annually by the zoning division, and work of this position would need to be absorbed by other division staff. The inspection services construction plans reviewer will leave one position to review construction plans for plumbing, mechanical, electrical, and energy conservation systems, as there are currently only two. The potential to double the existing review times for commercial buildings, which would be new additions and alterations, which note the fee increases proposed for this type between 70 to 79%. Removes coverage for this type of work, which will create a potential backlog when the sole position is out of the office. Next slide, please. The other three positions impacted by the FY 2026 proposal in the Development Fund include 3 vacant positions that are proposed to be frozen. I will note that there are currently 13 positions frozen within the Development Fund for FY 2026. This proposal would take the total up to 16 frozen positions, with the 3 being mentioned here. Positions and their impacts. The zoning technician, counter services, the resulting impact of a freeze would be longer review times for sign permits reviewed by the team. We anticipate, again, staff time will continue to meet or nearly meet established review times for other permits reviewed by the team. The zoning inspection supervisor will require the repurposing of an existing inspector position into a supervisory role to ensure appropriate oversight of the zoning enforcement section. Increase complaint response times from 2 to 5 days to 5 to 10 days. Response times to certificate of occupancy, special use permits, and active site plans will also increase due to increased workload on remaining inspectors and an increase in the use of overtime to complete time-sensitive requests. The ISD building inspector, a decrease in the amount of time each inspector can spend on-site during an inspection to comply with the state law of completing inspections within 48 hours. The reduced amount of time on-site per inspection could lessen the quality of the inspection. Taken all together, these cuts and freezes in zoning, which is 5 positions, and ISD 2, would have a compounding effect, as you can see overlap in the work responsibilities. Also here, we're proposing non-personnel reductions, bringing expenses in alignment with actual costs for such things like reducing operating equipment, printing, and office supplies. The impact to service delivery would be nominal in this case. Next slide. So a couple of examples of some of the fee impacts, and these examples I believe were shared by DES as well during their work session last Tuesday. And these slides are showing the change in fees as impacting several project types, residential and commercial. The takeaway here is that fees charged by CPHD and DES in FY 2025 would result in 49% increase in costs to a typical residential development of a single-family home, 58% for a large residential development of a single-family home with a 2-car garage, and 64% for a commercial mixed-use development of 16 stories with 3,500 square feet of retail and 2 levels of parking. This does include a 10% tech fee, and while these increases are seen as significant, we did review the impact as a percentage of overall project costs as provided in the next several slides. Next slide, please. So here, for the typical single-family home, the FY 26 proposed fee increases represent $21,000 or 0.97% of the total cost of the project. Next slide. For the large single-family home with a 2-car garage, the FY 26 proposed fee increases represent a $29.9 thousand or 0.99% of the total cost of the project. And next slide, please. For the commercial mixed-use development, the FY 26 proposed fee increases represent $1.76 million or 1.36% of the total cost of the project. So showing here planning fee increases and the resulting amount for certain application types between FY 25 and FY 26. For the live entertainment use permits, you see there the difference from FY 25 of $18.44 and FY 26 would be $52.95. For our open air markets, which are the same as farmers markets, $886 in FY '25, $2657 in FY '26. Child Care Center with less than 100 children, capacity of less than 100, $316 versus $949. And for a Child Care Center greater than 100, $695 up to $2,086 in FY '26. And then minor site plan amendment, and this example here is for one focusing on changing conditions only. So this might be a change to the condition text or some language in the condition. $6,087 in FY '25 and up to $16,000 in FY '26. In FY '26, a continued example of outputs and how they translate to outcomes similar to FY 2025. We looked again at our housing development and supply, a priority area for the county and the region to be consistent in tracking. The Affordable Housing Master Plan sets a goal of 17.7% of the total housing supply being affordable to households earning under 60% of the area median income, achieved with both committed affordable units, our CAFs, and MARCs, our naturally occurring affordable units. Some outputs shown here, FY 2023 and FY 2024 actuals to FY 2025 and FY '26 estimates for CAF rentals include looking at the number of approved CAF units, cumulative number of CAF units, total CAFs affordable at or below 60% AMI, total CAFs affordable at or below 30% AMI, rental homes provided to seniors, rental homes provided to family-sized households, and the total number of CAF units inspected. And you can see some changes throughout. Next slide, please. Our outcome measures, translating those outputs to outcomes. Our family-sized rental units consisting of 2 or more bedrooms provide stability for low and moderate income families as they integrate into their rental and county communities. Children attend schools, parents are employed and have transportation to travel to their jobs. Resident service coordinators on staff at CAF properties provide integral links so that all family members are successful in accessing needed support to be economically and socially successful. Our CAF rental homes that are dedicated to elderly households provide increased stability for low and moderate income seniors who are integrated into programs through their resident supports, which provides opportunities for socialization, health programming, food bank connections, and other wraparound services that support a resident to age in place and increase their quality of life. Other senior housing in the county is offered at market rate. Persons with disabilities are prioritized for accessible CAF units, and 59% of the accessible CAFs house someone with a disability, allowing them to live with accommodations that enhance their quality of life and provide connections with service providers that will assist them to remain in stable housing and in their unit for as long as possible. As of FY 2023, 43% of households living in CAF properties have lived there for 6 or more years. This longevity may demonstrate that households are content with their living situations and receiving support needed to remain. As of FY '23, 63% of households living in CAF properties have lived in Arlington for 10 or more years. This may demonstrate the strong ties that these households have to the county and their communities. And finally, the Housing Division will continue to review data to be utilized for additional outcome measures. This data may be collected via the Housing Division, the Department of Human Services, and our development partners. Next slide, please. This just shows some upcoming and ongoing projects and initiatives, and in speaking to the programs represented here, looks at CPHD programs, plans, processes, and projects being advanced in FY '26. I won't read them all, but you will see the focus on equity and engagement, housing, technology, data and development, growth management, neighborhood and community investment, and was what we understand to be countywide priorities. Things related to our neighborhood programs, large projects like Barcroft and our comprehensive plan update and homeownership studies, and work in the space of historic preservation. I want to highlight our CVMI, which is the Community Vulnerability Index Mapping Project. Some milestones reached, one for Affordable Housing Master Plan, and the other for Housing Arlington upcoming this year as well, and share a little bit about digital equity and what's to come. With momentum since the completion of the broadband study to implement the recommendations, we launched the county's Digital Equity Initiative with the coordinator, Jennifer Sco, leading the end of 2024. With $2.8 million from JBG Smith, we have developed a 5-year budget. Funds are in 4 categories as to how they are planned to be spent annually over the next 5 years. The first bucket is digital inclusion programming, which will include a NOFA program to provide grants to nonprofits and ultimately challenge grants to county agencies to address skill building, digital navigation, or device access. It is anticipated that there will be $500,000 annually put toward this for the next 5 years. The second category, planning and research, anticipated at roughly $25,000 in this first year, and then in year 3 or 4 potentially, $275,000 to pursue an update to the broadband study digital equity and action plan. The third category, events, around $10,000 annually for 5 years with escalation for convenings, tabling, focus groups, community events, funds for marketing, translation, and food, and potentially incentives. And then the fourth category, around $2,100 annually for 5 years with escalation built in for training and membership, so conferences, local events, and memberships. So year 1, we estimate spending $537,000 of that funding. And there's no budget, county board action needed with the adoption of the FY26 budget. Next slide, please. So this is a crazy graph, that image that could get even crazier in my mind, and I really wanted to add so much more. I think a lot of additional arrows and circles just added to it. But exactly. And where it's showing that it starts at the blue square development proposal, that actually is not always the start. There are many processes and it's very complicated. I wanted to note that the fee structure and system is complex, as the development process includes many entities, reviews, staff, and inaction may not always be a linear process depending on the projects and the development conditions. Also subject to economic and market conditions, as well as applicant submission, response and turnaround times as part of that review process. And land use, zoning, development, and permitting and review processes are interconnected across CPHD and several departments and review types. And not represented here are things that include other development review, building and planning processes related to the BZA, land use and zoning studies, zoning determinations and inquiries, code consultations, use permit applications, conceptual site plans, preliminary site plan application filings. Also things like amendments to use permits and site plan reviews and use permit reviews, landscape plans, administrative change requests, regular and continual ongoing enforcement of compliance with zoning ordinance, board-approved conditions, and the building and property codes. Also recognizing the work with several commissions and boards to include housing, planning, neighborhood services, historic preservation, among others, which either on its own or related to some land use and planning, building, and zoning processes occurs. So to reiterate what has been presented over the last, where are we now? Almost, 45 minutes? This is a budget proposal which acknowledges deficits and losses, but one that looks to provide stability and continuity of good governance, keeping in mind political, economic challenges and implications to staff capacity and morale, one that enforces being strategic and truly setting priorities, focusing on core services and programs of need or things required by code, law, ordinance, or some other element, over some other things. I would note that likely we will have a fair amount of questions and discussion on the proposed fee increases that are associated with work and planning, as well as zoning and inspection services and workloads, metrics, impacts to customers. I would be remiss if I did not conclude by noting the impacts to staff. For the department, it is capacity as work is across the teams in terms of support and the number of projects people carry out throughout the land use planning and development processes. In development funded positions, of which 13 have been and remain frozen, 3 additional positions are proposed to be frozen and 4 positions which are filled are proposed to be eliminated. The interest in growth management needs to be balanced with the reality when understanding the full life cycle of CPHD's work. and demands daily related to development and construction and implementation of plans and policies. So balancing the long-term land use planning with the current review of development and land use proposals, and then development review to permitting, to inspections, to occupancy of those buildings once approved, and then supporting residents as well as the continual work to ensure conditions are being met, reviews are completed to maintain and ensure compliance, and enforcement has to be understood from a department-wide perspective. Next slide. So I just wanted to conclude here that the focus, again, is a balanced, equitable, and measured approach for our budget proposal, and that's what we've intended to reflect here. And that, again, leaving you with CPHD is not just one independent division or discipline, but it really is a collection of disciplines that together facilitate the emergence of the built environment for people and about people. So people, places, and community. Thank you.
Thank you, Mrs. Bird. We recognize it's a very long and very, packed with issues. We are not going to exhaust today the discussion, but we can start with that. I would like to see whether we have some of our commissions here. I should note that our planning commissioner, Mr. Strine, that would mean be here to present. He cannot make it, unfortunately, and this is, if you ask what is the reason why we have a special commission session that's after work, is in order to make it possible for commissioners who, under normal circumstances, have to be at their work and they cannot participate in a middle of the day meeting. So this is still coming. I have some questions here. If there is time, I will make them. And I don't know if we have our Historical Affairs and Landmark Review Board here. Yes. That should be Ms. Foster, right? Yeah. Thank you so much for taking the time.
She gets a prize for being.
If you can switch on your, yes,
Press the button.
You are good.
Okay, sure. Hi,
Awesome.
everyone. Yes, my name is Alexandra Foster. I'm the Vice Chair of the Historical Affairs and Landmark Review Board, or the HALRB. I've served on the HALRB
Can you get
since-
closer to the microphone?
A little bit closer. Is this better? Okay.
That was better.
Since June 2022. The HALRB supports many of the ongoing goals of the Historic Preservation Program, or the HPP. In November 2023, the County Board adopted the Historic and Cultural Resources Plan, which is the primary policy document guiding the county's historic preservation vision, goals, and actions. The goals of the Historic Cultural Resources Plan revolve around the community engagement, incentives for preservation, strengthening partnerships, evaluating existing and creating historic preservation regulations, improving the HPP's use of technology, information, and tools. So there are two short-term goals from the Historic and Cultural Resources Plan that the HALRB wants to support HPP staff on for the upcoming fiscal year 2026. The first is updating the Historic Resources Inventory, the HRI. Adopted in 2011, the HRI has helped balance preservation goals and new development. The HLRB supports expanding and updating the HRI to provide stronger guidance on preservation treatments and lead to more proactive protection strategies for HIR-ranked properties. Now, second is to evaluate the local historic district process. Given recent trends of increased LHD requests in conjunction with redevelopment projects and the new legislation on the Code of Virginia that prevents demolitions until the LHD process is complete, the HALRB recognizes the importance of evaluating and improving the process to ensure objectives of the LHD program and make sure they are achieved. The HALRB also supports many ongoing goals of the HPP, such as supporting the continued growth of the Historic Preservation Fund, utilizing historic preservation tools for the highest risk and least protected resources, and finally, fostering collaborations with both internal and external stakeholders, engaging communities that traditionally do not participate in historic preservation, and highlighting diverse stories in historic places through outreach programs. So I urge the County Board to continue supporting the HPP's important work and providing them the resources necessary to achieve the many goals identified in the Historic and Cultural Resources Plan. Thank you.
Thank you, Ms. Foster.
So, colleagues, we heard from CITSAC. The conversation is with us. Mr. DeFrantis, you're like.
I feel like sometime I'm going to ask if colleagues want to go first. I'm willing if there's a void, but I have no need. All right, so I'm willing, but I genuinely mean that.
You're already talking.
All right, all good. So there's no winning on this one. So the positions. I don't know if it's for you or Mr. Fucirelli on we had a whole work session on enforcement. And then there's a third position, and then there's the planner position. I guess we had at our work session, I asked a little bit of a question on the two different positions, freezing, that we were funding one and not the other. But this principal planner, is there a way to describe some of the work other than it is a comprehensive planner position? But is there a way to describe, we can't say whether this would be working on CMRI or Langston Boulevard implementation. It could be working on all components of that equally, or is there any way that you can give us a little more tangible pieces to what the principal planner would be doing? And this is not my question. All of us got it. It's the Planning Commission's, lest I take credit for, but it is a question that the Planning Commission would have asked.
So it won't be a very specific, at this point, assigned to a specific project, but really is providing support and capacity overall to help manage and lead projects where needed. I don't know if, Anthony, you want to add anything more, but I mean, it really is not defined very specifically.
Great. So then I guess it's a question for the manager and maybe DMF. We need to find some ongoing, right? If we want this position and the other position, we would need to find some ongoing, assuming, as is the place that all of us have stated, that we're not interested in the real estate portion of we got the meals tax and we got the real estate portion. There is a page that I think is in the budget, but I've only scanned. I think it's page 25 that may be talking about potential. Do you have a mechanism or an approach to find a way for us over the next week or 10 days to identify ongoing cuts that are more or less palatable to us, keeping in mind the challenge of the vacant positions and the other positions? I'm not saying that you have to point them to us publicly. I'm saying, do you have a process recommendation for how we try to do this? Or is it reading the full budget? Any thoughts on how we do that? Because those two positions, at least, I don't want to say I'm in support of random 9 positions and not point to where we would find the ongoing reductions, if so. So I don't know if you have thoughts.
Well, there's a lot of things to balance in that question, and I would refer you to the parts of the page and a half in the budget where we talked about additional program cuts if possible. The other thing is, and I'll make this comment, and it's my personal comment, and since the budget is with you, you can weigh it as you see fit, and Samia may have her own comment. If you asked me to take all the personnel cuts across the entire department and add back one position, I personally would not pick the comprehensive planner. I would probably pick one of the positions we had to eliminate from the development fund. And I would and that doesn't mean you have to agree with me, but I think Samia made a really good point talking about how the organization works together. The development projects go through an entire process, and I think we'll be able to deal better with that one vacant comprehensive planner. That'll be a little bit easier to swallow than some of the one of the inspection services positions. Now, that's just my view. And everybody's entitled, and I know the Planning Commission had a different view. That's my view. And I don't know if you don't have to comment on that, Samia. You don't need to choose among your children.
They are all equally important and different. They are all different, but they all play a role. I would say that if it is something that you're considering, The position that really stands out to me most is the codes examiner position, because there are only two. And that is reviewing a lot of our trade permits. This is real-time development-related work. And so that is the one that would have the most significant capacity decrease. The principal planner position in comprehensive planning, as the work program was presented last week, has already sort of been accounted for in what we're looking for FY26. And I would say also about the comprehensive planner, and Anthony may, have a little bristle back there, but we talked about this a little bit, that if you are looking at planning capacity, one place we would actually consider would be an associate planner, because the comprehensive planning team has a significant number or a considerable number of principal planners relative to associate planners. And so to be able to help balance out some of the work, so it's not all just like management oversight and leadership in that capacity. It's, being able to actually do some more of the hands-on work and support. So I would just leave you with that. I don't know if Anthony or even Shariar, since I referenced the position that would impact ISD and the development fund, if you have anything you want to add, but that's my.
I see Ms. Coffey and then Ms. Cunningham.
Thank you. The construction plan review position was the one that I actually wrote down while you were talking, because I think particularly highlighting that if the one person is out of office and we want everyone to be able to take their well-earned PTO vacation time, that nothing could happen on that while they're gone is really concerning, I think. If they had, let's say, FMLA or something, not a great situation. And I assume that construction review is a mandatory part of our process. So it's not like projects could, it would be a dead stop, which also means that if someone were to leave for a different role or retire or something from that position, we may not have the ability to have someone in place. We could go down to zero. And so those are things that I am definitely considering. And I know there was an extensive review process getting to even this point with all of the development fund fees and permits and roles. Is there any possible way to raise permit fees to cover that role? Is that an option, or have we kind of maxed out on what we're able to do to get cost recovery there?
So that is included in,
That is
because those are
already.
the trades permits.
Yeah.
Right?
Okay.
Am I correct?
Yeah, so that's already, okay, great. And then I think, a question on the worst case scenario management side. We're looking at cost recovery with current types of projects moving and coming in and being part of this, but given some of our macro circumstances, if those projects stop moving and people stop applying for permits, how does that impact the development fund? Will we be, I guess I'm worried about coming back next year again and saying we did all of this and it's still not enough.
It is a multi-year process, right? So even though we raise the fees in 1 year, when we see the impact of them may not be for another year, just because of the way development works and when things hit the fund. We really can't predict or say, we are really subject to a lot of macro economics and other things that are happening in the environment. And so, this is the best approach that we can put forward to try to at least bring some sense of balance to it. I think some of the proposals that we made, trying to at least restructure things and realign some of the work that is not associated with the development fund to try to take some of those pressures off. Some of the other fees, like the tech fee as well as the fee from the utility fund, I think those are things that may help, but it's hard to say. It's possible, just given the climate that we're in, that this is just a multi-year situation that will compound, but we're hopeful that this will help to at least start to bring some reduction to the balance, the fund balance being negative.
No, and I'm greatly as I said, I know extensive work went into even getting us to this point, and so I'm really appreciative of that. And I want to set us up for success as best possible, and I know you do as well. I think I'm just thinking of, we know that the Great Recession, for example, almost all development just kind of stopped for quite a few years. And so I don't know if that's where we're headed, but it wouldn't surprise me if someone said that we were. So I'll pass along from there.
Thank you, Ms. Coffey. Obviously, revenue and process relevance is important, right? Before anything else. Ms. Cunningham.
I'd just like to ask Mr. DeFrante's question in a slightly different way. So last year, we had a less dire but still painful conversation about potentially reducing force. And I think most of this board, the majority of this board, pushed back and asked you to keep 2 of those positions. Can you tell us I guess first of all, did we fill those 2 positions, or are those the 2 that are vacant? And then can you tell us what we wouldn't have gotten this year, just, if we didn't have those 2 positions filled?
So both of those positions are now filled. So we started the recruitment process soon thereafter, the budget adoption, and we were able to fill both of them. I don't think either of them have been in place fully for maybe 6 months or so. I think both of those positions really did just add additional capacity to the workload of the team. And similar to this year, and Anthony, correct me if I'm wrong, but I do believe when we presented the work program last year as well, we had already taken into account that we likely may not have those 2 positions because of the way the timing fell with the proposed budget and those 2 positions. So I don't know that there's necessarily anything that would not have been done, but we can.
Thank you. Good afternoon, Anthony Fusarelli with the Planning Division. Just to build upon Ms. Bird's response, it is correct, those 2 vacancies, one was an associate planner in the comprehensive planning team, the other was in current planning. So the way I would best describe it is a little bit similar to what I was describing last week in our conversation then, which was the review times for some of the use permit reviews or amendments and other applications would have been longer, or there would have been greater staff and demands placed on the balance of the team. On the current planning side, on comprehensive planning, it may have been that some of the zoning studies and amendments that came forward to the board for action within the past year may have taken a little longer as well. They may have trailed perhaps a month or 2 or 3, depending on that. So can't really point to a specific project, but just a slower pace or more gradual pace of work and increased demand or increased workload for others.
Great. And then similarly, you mentioned that some of these gaps might have to be filled with overtime going forward. And is that sort of priced in that, you pay more for overtime, you have more tired people, and then there's less cost recovery, or is that already priced in?
And those were on the development fund side. I don't think they're there. Okay. No, I don't know that they've been priced out, what that would be, and how that would be.
I can restate the question. I know it's been like a 7-hour meeting already, so. Do you want me to restate it? No, you're good.
No, it was.
We can just follow up
So
later.
you were just asking whether or not the costs for overtime, should those positions that are frozen, proposed to be frozen, or eliminated, require that in order to add capacity, that we would have to look for consultant or overtime. Other people will work longer hours to fulfill some of that work.
I think you have a phone a friend behind you. Do you want to jump in?
Oh, no, she's there.
She's got it.
Yeah,
Okay.
so I don't, it was not built in to the proposed.
Got it. And then maybe zooming all the way out, and this is for everyone who's been just beating on this all year. I know it's been a painful process to kind of come to terms with the development fund and the absence of reserves that we had built in initially. Absorbing that in a single year, in a single really bad and tough year that we've had and may still have, it seems hard. So have we thought about a scenario where we take 2 years to build back, that we spread it across another 2 years, or we go and put reserves in place, we kind of backfill the reserves that we used for the capital, for things we maybe should have capitalized in the end?
So we've spent some time talking about this in advance, and you could give us direction to come back to you in the next week or so with different scenarios. We have thought about it. If the fees, because Samia went through this very carefully, and I know it seemed like a lot, but she was saying at some places we had planned to go over 3 years on the fees, and now we're doing them in 2 years. If we went back and looked at that, we can model that out. What's going to happen is that the fund balance will become more negative, but we will be committed to doing it over a longer period of time. And just so you know, the impact of having a fund balance being negative is that that money comes from somewhere else on the bottom line. But we looked at that, and we can come back with those alternatives. I think it's just a matter of getting direction from you on that. I mean, I was pretty clear when we were doing budget formulation, much to my consternation and much to the regret. I mean, Shariar had hair when we started the whole process. But I said we have to come in with a budget because the development fund premise was that revenues would equal expenses. And since 2008, in 2008, the fund came in place right when the Great Recession was happening. We have not experienced these kind of macroeconomic issues. It can't sustain it. And so what you're seeing is a real strong, I'm not going to call it overreaction, but maybe an overcorrection. It's a strong correction.
Right.
And so if you want to spread it out, you have that's something that you could direct us to do, but realize that the money is still coming from somewhere else to balance it.
Sure. Yeah, and it seems like we are correcting two things at the same time. One is getting to full cost recovery, which we had planned for 3 years, and I appreciate the instinct to make it faster. Maybe that's reasonable. But we're also correcting the absence of reserves as we enter a time that is rather challenging, and we can see where the marbles may fall. And so I would say I would like you to go back and at least get one scenario, but think about which scenario, or maybe there's two. One is that you, instead of addressing both of those, you address just one of them this year, and then we work on addressing the other the following year or a couple of years out.
I would add that the multi-year approach, where we said 3 years, that was really just for the zoning fees at the time. So ISD fees, we were always anticipating would recover over 100% over a 2-year period. So FY25 and FY26. For the zoning fees, we were looking at spreading those out over 3 years. And then the planning fees, I think, is what also we said would just be over time and only up to 75%. So there's some variation there. I just wanted to clarify that.
Yeah, that makes sense. And I'm happy to work offline a little bit with which scenarios, but it feels like a little bit too much to carry in 1 year. And also, I think as we talked during the work planning session, the result is that if I am the brave soul ready to do a development project in 2025 or 26, then I've got both the extra fees and potentially the slower service, and that doesn't feel right.
I did want to say this because I know Mr. Spain and I had the benefit of being together most of the day today. We were at the Economic Development Commission, and I feel very strongly about this. Doesn't mean the point you're making is wrong, but for large developers coming in to do a project, I think that, I can't speak for them, but the macroeconomic forces we're facing and what's going on across the river are really chilling development. And so my main concern about all these estimates is, I think, the question that you brought up, Ms. Coffey, which is that we may not see as many of these projects as we're assuming for the revenue estimates, because I will say that these increase in fees, though they seem relatively large, are not top of mind for the development community. That doesn't mean they're good or bad. It's just not really driving what we're going to see over the next 6 to 12 months.
And one more additional clarification. So we wouldn't be solving for reserves either in this year. We would simply be closing the gap, so addressing the deficit. So there won't be any reserves.
Right.
So I just wanted to clarify that.
Right, which also fits into your concern there. Got it.
Thank you, Ms. Cunningham. I never had the concept of reserves on a fee structure. Who benefits from this? I can imagine a reserve for a service, for example.
But we do have in our utility fund we have a buffer to deal with unanticipated circumstances.
So that we keep personnel employed, et cetera. Mr. Spain.
Alas. Hello, Ms. Byrd. It's been a long meeting. Thank you for your service. And also thank you for all of your leadership, especially prior to assuming this role you're in right now and what you've done. I do have a few questions, right? I first want to align myself with the words and concerns of my colleague, Ms. Susan Cunningham. I understand how we have these FTEs, these positions that we are going to may have to make a decision on, but that means other folks are going to have to pull their weight, right? And you've kind of alluded to that earlier where you talked about how it's going to affect some of the time frame it's going to take to render services. I'll tell you where I'm also concerned is about employee wellness and quality of life, right? So as you went into making these decisions, and I understand you're talking about the life cycle, what you do, I have a question here. Do you believe that these positions that you've recommended to us, are they mission critical? Do we need them? Because what I don't want to have happen, it goes to this piece about overtime. You can take away, right? But then you're also going to, stress other folks out and have them working all the time. You get it. So are they mission essential? Do we need them? Or can we just, I know you make a recommendation, but I need to hear, because other folks got to pick up slack.
I will say that what went into our approach in looking at the positions is it wasn't just a blanket, okay, these are the vacant ones, let's look at those. But we did try to look at what are the services that are being provided? What are those things that are discretionary? What are those things that are non-discretionary? And what is the role of the positions within them? Each division was asked to look at their work and to provide some information about how they could align their proposal with what we needed in terms of making reductions, in terms of what was, to your wording, mission critical, meaning we have to do, nice to do, et cetera. So I think what we've come back with are those positions that we've found some balance in and some way to be able to expand the work and the capacity across the department if we don't have those positions versus some others that we might have put forward that we were like, we can't lose those at all.
And I would assume that you're going to perhaps put in place or implement something to not only monitor those employees that are left to carry the weight, but also what our overtime numbers may look like in the short and long term. I just have a few more questions. I asked this question earlier. For these positions that we're either the ones that are frozen, have no one in them, that's one thing. The ones where we're going to be actually losing employees, could you submit to me or to the team gender and race, folks that are in those positions? Not names, I just need gender and race. I think you, given your past experience, know where I'm headed with this when we come to the end of this plan. Also, when I look at page 27, I get the math a little bit, but for those that may not have taken a good look at it, these percentages of changes are really extraordinary. 187% increase, 200, 163. Again, remind me, what was the driving factor behind these significant increases?
So these increases are related to the proposed fees. So
Right.
for planning-related fees, depending on where they were or are today, to get to the 100% of cost recovery, which is the cost of staff time spent on working on these types of applications, then that's what is associated with the cost of the fee.
Okay. Last question I have is, and I spoke with my colleague earlier today, the Community Development Fund. That is federal grant money we receive, and your team makes a decision on where this money may be going. Goal 4 of the program talks about fostering vibrant and sustainable neighborhoods. These organizations that are identified, what metrics, what goes into, how do you identify who gets what? Because there's folks here that aren't recommended, right? But then there's some that are going to be receiving. What goes into that equation, that metrics, that decision making?
So for that, we have a full grant process and program. And so everything is built into that process, the application process, the scoring, the criteria that they have to meet in terms of the proposals that they bring forward for the organizations. I know we have the FY26 proposals coming up for the grantees, and I know that there are probably some questions about that. I don't know if there's something else we want to add specifically, Ann?
I would just say for this, and I'll be talking about it perhaps later on down the road, from what I see, there may be multiple organizations that are in receipt of funding from different lines of areas within our budget that are nonprofits in Arlington. And I'm trying to understand, is that the most equitable approach as we're trying to disperse where grant funding? I think you know exactly what I'm talking about. With that being said, thank you very much.
I spent a lot of time on that process before, so understood.
Thank you, Mrs. Spain. Mr. DeFerranti?
Sure. So really quickly, I want to try to see if I understand and align with Ms. Cunningham's sort of, you asked for direction, Mr. Schwartz, if we were going to come back on the funds. First question for me is, I guess I would love it if we could try somehow. I haven't heard from anybody. NAOP, nobody else. I'd rather hear from someone. And the folks, we have to do fees not equitably, it seems to me, under the Virginia law. You have to do it equally. So if the incidence falls disproportionately more on 9,500 square foot homes, that won't keep me up at night. But, I mean, is there a mechanism, a system? We'll hear at the end, the 25th and 27th, we'll hear from some people. But I haven't heard from anyone who says these fees are an economic development challenge. I wasn't at EDC this morning. I haven't gotten an email. It's possible. I'm not at all saying, but it would be great to see if we could get a little data. And I'm not saying like a survey. I'm just saying like, should we talk to NAOP? Should we talk to other people? Not because anybody has veto power, but because, nobody wants fees up. But if you're not feeling an instance and you're building a 16-story building, then I'm okay with that. So that's one question.
Well, the way the timing worked out, we actually meet with NAOP tomorrow morning.
Great.
So you may hear from them soon thereafter.
Sure, that's all fine. And then the other, and now we're going to hear from them big time. But the other question I have is I would associate with a desire to at least calibrate, because, it's been 49 days or 53 days since the inauguration, and this is different than a little bit. So I would love that direction, not that you need to say no. If you still believe we got to do these quickly, fine. But if we can space out the fees in a way that is more nuanced than the proposals you've already made, I'm interested in it. Not because I think the world is going to be simple next year or the year after, but, when we have time to work through. I don't want us not to be bold, but I do want us to, I just want you to share with the board, your team, to say, we looked at it again, and we think there's these 5 of the 94 fees that we ought to graduate over 3 years or 2 years instead of 1. I'm not saying don't do the hard work. Ms. Coffey's right. This has been a colossally hard thing that you guys have done and that you've done. And so, but I do think it's worth taking another look along with what Ms. Cunningham said.
And if I could just add, with how many fees do we have? 393 fees or something like that? Yeah, nobody can accuse us of being nuanced, okay? I think that's a fair statement.
Yeah, thank you. Ms. Cunningham?
Give people a minute. I just wanted to do a little bit of thinking about flexibility. So I think this is a year that is going to challenge us all. And we've talked a lot about resilience, whether it's economic resilience or human resilience or community resilience. We don't have to do it now, but maybe as we come back with some scenarios, what could we do to make our capacity to serve development projects and inspections a little bit more flexible? So whether that's some of our people being on call, or it's a third-party inspection or partnership kind of model, or it's early, I don't know if it's retirements and then kind of on call, come back. I don't know that there is one, but I'd just like to think through. It sounds like we have no idea what's going to be ahead of us, even more than usual, and that when there are projects, we want to be moving real swiftly on them. And when they're not, we want to be preserving capacity. So just thinking through what tools might we be able to tap. I know we talked about cross-training previously, et cetera.
I would share that, I know the question came up about third party or contracting. One of the spaces, we did do that previously, but it was not advantageous, and it was not something that actually provided quality service, nor did it increase time. And I would say that that would be the same on both ISD and in zoning in particular, because our process is nuanced, and getting someone up to speed to understand site plan conditions and use permit conditions, I don't know that that would be valuable to advancing anything more quickly, if that is the goal. Understanding flexibility, though, in terms of like cross-training, et cetera, to add capacity, that seems a little bit more doable, but I don't know that we would recommend contracting or third party as an approach.
I just want to address cross-training, and that was, do you have capacity? Most of my jobs, we have about 10 vacancies in ISD alone. So I'm not, we have made that. Most of my job is actually job we are cutting. These are 2 mechanical engineers. I can't bring a building guy or electrical guy to do a mechanical engineers. So these are very particular positions with their own expertise. And literally with the complexity of buildings, when I bring a new plan review, it takes 4 or 5 years before I put them on a 16-story multi-use building. It's intense work.
Gotcha. Thank you. And then I would say, in addition to that, process improvements, where might we be able to streamline, or like we did with CRMI, try going a little faster? I think it's part of being flexible. These next couple of years, there might be an opportunity to try some of that, and I think your board would be with you.
Thank you. So before we conclude, I heard a little bit from developers. I also heard, we will hear tomorrow from NIOP, right? I think that fees are important, but time and flow and predictability of the flow of a permitting is even more important. I believe that in the current circumstances or in the current financial costs, this is the most important variable. So I hear a lot about the time that it takes, and many times we don't control that time entirely. It's also the public process that controls that time. Right, and it's many, many times that we brought here people again and again, to re-litigate again, many things, paying extremely high fees to their lawyers, far higher than they pay us. Actually, and that's something to consider, and adding to the layer of what is equitable, etc. I'm a little bit, not a little bit, I'm more concerned about fees that are paid by permits for small businesses, etc. Instead of trying to, and I understand what cost recovery means and what it means in the in between. I'm not so prone to agree, fast to agree, I should say, to stagger that over time. But yes, I would like to see an offer. For example, if you cannot pay your fee immediately, we could do that in installments, etc. We had a long conversation with the Commissioner of Revenue of how this could be structured, so that.
I just want to. I've agreed to come back with another option. Okay. I haven't changed my opinion about what the right option is, but I'll give you another option.
Yeah, we
You can evaluate it.
Sure, there are ways to dedicate other funds to, or other types of money. Anyway, thank you so much for the presentation and the conversation. I think we are way over time today. And we tax the time of everybody else. That produces also it's way after 5 p.m., so it creates probably some overtime. So thank you indeed very, very much for taking the time tonight. We will have follow-up conversations, I'm absolutely certain. So this concludes this part of the meeting. Our meeting continues for this part, for the people who are at this table. And it continues with a motion to convene a closed meeting. The motion is that I move that the county board convenes a closed meeting as authorized by Virginia Code Sections 2.2-3711.a.1, 3, 5, 7, and 8 for discussions regarding the performance of board appointees and discussions regarding the disposition of publicly held real property where discussion in an open meeting would adversely affect the bargaining position or negotiating strategy of the county, and discussions regarding the expansion of an existing business or industry where no previous announcement has been made of the business or industry's interest in locating or expanding its facilities in the community, and consultation with the county attorney regarding actual and probable litigation where such consultation in open meeting would adversely affect the county's litigating posture, and consultation with the county attorney regarding the applicability of certain laws and enforcement actions on local governments. Is there a second?
Second.
It's seconded by Mr. Spain. All in favor, please say aye.
Aye.
Aye. We are in closed session. Thank you.